Good day, everyone, and welcome to the third Sharjah Regional Cervical Cancer Forum. This forum is hosted by Friends of Cancer Patients in partnership with the United Nations Population Fund, Arab State Regional Office, and in collaboration with WHO. The forum will be over 2 days, today and tomorrow, and it will be on a virtual format. It will cover in depth the turning point on cervical cancer elimination and HPV vaccination, signposts and directions. This webinar is to address the actions and collaborations needed in order to tackle cervical cancer and save countless lives across the region. The forum is CME accredited with Dubai Health Authority with 9 CME credits. Dear attendees, please, you are kindly requested to fill up the evaluation form by end of each day to get the certificate of attendance by email. I would like to introduce today's agenda, starting with the opening keynote presented by Her Excellency Mrs. Sausan Jafar, Chairperson and President of the Board of Directors, Friends of Cancer Patients, UAE, followed by an opening keynote by His Excellency Dr. Abdulrahman bin Mohammed Al Awais, Minister of Ministry of Health and Prevention, UAE, followed by an opening keynote by Dr. Rana Haji, Director Program Management at WHO Eastern Mediterranean Regional Office, followed by an opening keynote by Dr. Hala Youssef, Sexual and Reproductive Health Advisor at UNFPA. Without any further delay, we would like to start our welcome session today by introducing Her Excellency Mrs. Sausan Jafar, Chairperson and President of Board of Directors, Friends of Cancer Patients, UAE. Mrs. Jafar holds a BS in Economics from the American University of Beirut. She is a founding member of the board of the Friends of Cancer Patients Society in UAE and acted as its chairman from 2000 to 2008. Mrs. Jafar also won a prize for voluntary work in the Emirates of Sharjah, UAE, and has been a founding board member of the Arab Fund for Arts and Culture. We will address her recorded video.
Ladies and gentlemen, members of local, regional, and international health authorities, civil societies, and NGOs, I welcome you all and commend your efforts for our collective goals towards the elimination of cervical cancer. We at Friends of Cancer Patients are proud to host the third Cervical Cancer Forum 2023 in collaboration with the United Nations Population Fund and the participation of local, regional, and international organizations, following up to the first and second forums held in 2021 and 2022. We get together again in this virtual forum to discuss the progress made, develop an action plan, and follow through our commitments pledged during the second Cervical Cancer Forum in 2022. In line with the Sharjah Declaration 2.0 to endorse the establishment of a robust monitoring treatment framework for the progress of HPV vaccine implementation and cervical cancer elimination, which have facilitated data gathering and the monitoring of results, we are now here to present and assess the progress we have all made since our last forum, pursuant to our collective goals within the WHO Cervical Cancer Elimination Strategy for 2030. Cervical cancer, as we all know, is the fourth most common cancer in women, with an estimated 604,000 new cases in 2020 and an estimated 342,000 deaths in the same year. of which about 90% occurred in low to middle income communities. Through our collective understanding, the high mortality rate from cervical cancer can be reduced through a comprehensive approach that targets prevention, early diagnosis, effective screening, and treatment programs. Elimination of cervical cancer is a cause we are all committed to, and through our consolidated efforts at this year's forum, we can move closer to relieving the world and our communities of this lethal, debilitating condition. Even though the tasks we set ourselves are challenging and not always straightforward to achieve, through the action plan we will develop this year, I am confident that we will get closer to what we aspire to achieve in eliminating cervical cancer and creating a brighter future for the world we live in. Thank you again, and I wish you fruitful and productive deliberations towards our goals.
Thank you, Mrs. Jafar, for this welcome message. And without further ado, we would like to introduce His Excellency Dr. Abdulrahman bin Mohammed Al Awais. His Excellency Dr. Awais has joined the federal government in 2006 as Minister of Health, of Culture, Youth and Community Development. In addition, he has held the position of Acting Minister of Health from 2011 until 2013, when he was appointed as Minister of Health. He has been also appointed as Minister of State for Federal National Council Affairs following the cabinet reshuffle of October 2017. Dr. Awais holds several executive positions. He is the chairman of the Dubai Culture and Arts Authority. He is a board member of Dubai Healthcare City. He is the chairman of the Board of Trustees of Hamdan bin Mohammed bin Rashid Al Maktoum International Photography Award. He is a member of the Board of Trustees for Sheikh Hamdan bin Rashid Al Maktoum Awards for Medical Sciences. He is a member of the Board of Directors of the Emirates Foundation for Philanthropy and a member of the Board of Trustees of Sultan bin Ali Al Awais Cultural Foundation since 1992. He is also the first Vice President of the UAE National Olympic Committee. We will address his recorded video.
أخواتي إخواني، السلام عليكم ورحمة الله وبركاته. بداية يسرني أن أتقدم بخالص الشكر والتقدير إلى قرينة صاحب السمو حاكم الشارقة سمو الشيخة جواهر بنت محمد القاسمي، الرئيس الفخري ومؤسس جمعية أصدقاء مرضى السرطان، على دعمها البارز لنجاح خطط وبرامج جمعية أصدقاء مرضى السرطان في تأدية رسالتها الإنسانية والتوعوية. وأشكر سعادة الأخت الفاضلة سوسن جعفر رئيسة مجلس إدارة جمعية أصدقاء مرضى السرطان وفريق العمل على إقامة هذا المنتدى الثالث حول سرطان عنق الرحم بهدف تعزيز الوعي المجتمعي بالمرض وتكاتف الجهود الوطنية في هذا المجال. السيدات والسادة، إن دولة الإمارات وبفضل توجيهات القيادة الحكيمة تعد من الدول السباقة على المستويين الإقليمي والدولي التي تتبع أعلى المعايير لمكافحة فيروس الورم الحليمي البشري وسرطان عنق الرحم، كما تحرص على تطوير السياسات الصحية بالاعتماد على البحث العلمي ووضع المعايير وأطر العمل وتطويرها وتنظيمها ضمن برامج استراتيجية وطنية لمكافحة المرض. إن القطاع الصحي في دولة الإمارات يبذل أقصى الجهود لينعم مجتمعنا بأفضل الخدمات الوقائية الصحية وبطرق مستدامة. وفي هذا الإطار أطلقت وزارة الصحة ووقاية المجتمع الخطة الوطنية لمكافحة السرطان بالتعاون مع شركائنا الاستراتيجيين وجمعية أصدقاء مرضى السرطان. ولتحقيق أهداف هذه الاستراتيجية اعتمدت الإمارات إدراج لقاح HPV لمكافحة فيروس الورم الحليمي البشري ضمن البرنامج الوطني للتحصين، وتعد دولة الإمارات الأولى على مستوى إقليم شرق المتوسط في هذا المجال وبنسبة تغطية 82% للجرعتين. ختاما، أتمنى للجميع النجاح والتوفيق بما يدعم العمل المشترك لاستشراف مستقبل الحياة الصحية والمساهمة في تعزيز صحة أفراد المجتمع وجودة حياتهم. دمتم بخير وصحة وسعادة.
Thank you, Dr. Awais, for this welcome message. And now, without further ado, we would like to introduce Dr. Hala Youssef. Dr. Hala Youssef, Sexual and Reproductive Health Advisor at UNFPA ASTRO. Dr. Youssef, a professor of public health at Cairo University Medical School. She currently working with UNFPA Arab States Office in Cairo as a regional sexual and reproductive health advisor. She also has the position of the Population and Development Advisor at ASTRO for the past 5 years. In 2013 to 2014, Professor Youssef was the director of the Egyptian National Population Council, leading on the National Egyptian Strategies for Population and Development 2015 to 2030. In 2014, she was a member of the Advisory Council on Community Development to the President of Egypt. In 2015, she was appointed as the Minister of State for Population in Egypt. Dr. Hara enriched her expertise through working as a professor, mentor, and a researcher on population and sexual and reproductive health studies with renowned publications at both national and international level. Welcome, Dr. Hala, and the floor is yours.
Thank you so much. Let me address Her Excellency Sausan El-Fahoum Jafar, Chairperson and President of the Board of Directors for the Friends of Cancer Patients organization at the UAE. Also, His Excellency Dr. Mohammed Abdurrahman bin Mohammed Al Awais, the Ministry of Health of Prevention at United Arab Emirates. So I thank them for hosting us. It's my great pleasure to be with you today. Can you hear me? Okay.
Yes, doctor, we can hear you.
Okay. Because I had a different screen. So it's my great pleasure to be with you today at the third Sharjah Cervical Cancer Forum 2023, Turning Point on Cervical Cancer Elimination and HPV Vaccine, the Signposts and Directions. I would like to thank Friends of Cancer Patients for gathering us here together. Today, in a fast-changing world where security and health threats emerge at any time, we need the important role of advocacy and leadership in helping deliver evidence-based solutions. When it comes to cervical cancer prevention, huge inequalities are still there between and within Arab countries and between different vulnerable groups. Focusing on advocacy and equity issues at this year's forum meeting is very timely. That's exactly what Sharjah Forum declarations offer through its commitment to advocacy, cooperation, data utilization, and endorsement of a monitoring framework. The Sharjah regional forums are the outcome of collaboration between Friends of Cancer Patients Organization and UNFPA Arab States Office. And the forum supports the global strategy for the elimination of cervical cancer and is considered a roadmap for the 90-70-90 targets to be reached by 2030. A monitoring framework with 26 follow-up indicators was developed by UNFPA Arab States, and accordingly, 6 pilot countries were selected to implement this framework for data collection, including Libya, Morocco, Oman, Qatar, Sudan, and United Arab Emirates. Progress of the countries will be presented today. The Arab countries are characterized by societies sharing cultural and religious conservatism. Given the specific cultural context, this implies more conservative behaviors than in other cultures. Accordingly, there are low estimates for the prevalence of sexually transmitted infections, including the human papillomavirus, HPV. However, with the globalization and the rapid changes in lifestyle, war, conflicts in many countries with greatest risk of sexual exploitation of women and children in humanitarian settings, these factors together may lead to major consequences on the prevalence of sexually transmitted diseases in the region. And age-standardized incidence rates for cervical cancer are estimated to be below 10 per 100,000 in most Arab countries, except Somalia, which reaches 25.4, Djibouti 13.4, and Morocco is 10.4. However, those estimates should be interpreted with caution due to limitations in cancer registration data. Although cervical cancer is considered nearly completely preventable through effective primary and secondary prevention measures, these measures have not been equitably implemented across and within countries. The availability of an effective and safe anti-human papillomavirus vaccine for primary prevention and advocacy for cervical cancer screening for women for early diagnosis and treatment are excellent opportunities to eliminate this disease from the Arab states region. Representatives of governments, academia, international organizations, experts, and advocates met in 2019 at Sharjah and 2021 virtually to follow up on the progress and boost the national and regional response. Ladies and gentlemen, we all need to work together. Today, UNFPA Arab States and Friends of Cancer Patients renew their full commitment to cervical cancer elimination actions in the region. We value the country's support in gathering data and information that enable us to better monitor how cervical cancer prevention strategies and roadmaps are progressing. At our first Sharjah Cervical Cancer Forum 4 years ago, UNFPA Arab States, with our partner Friends of Cancer Patients organization, started a journey to eliminate cervical cancer from the region. And later, 4 years now, we remain very much on board with our vision. We can maintain together the momentum in our cervical cancer elimination efforts as we respond to Sharjah Declaration commitment, and together we can make a difference. Thank you very much.
Thank you, Dr. Hala, for this welcome message. And now, without further ado, we would like to introduce Dr. Rana Haji, Director, Program Management at WHO Eastern Mediterranean Regional Office. Dr. Haji is a senior public health leader with over 27 years experience in global health, infectious disease epidemiology, health policy and diplomacy, and health management, especially in the Middle East region. Dr. Haji is currently holding the position of the Director of Program Management at WHO Eastern Mediterranean Regional Office since April 2019. Dr. Haji holds a medical director degree from the American University of Beirut, Lebanon, and is an American board certified in internal medicine and infectious disease. Dr. Haji, welcome, and the floor is yours.
Wonderful. Okay, great. Thank you. Thank you so much. Good morning. Sabah al-khair. Assalamu alaikum. And it's really it's a pleasure to be with you all this morning. And this is for a topic that I feel really very passionate about. So I appreciate all the efforts by Sharjah and by this forum and the Friends of Cancer to bring attention to this really important public health topic. And thank you very much for all the organizers also for giving me this opportunity on behalf of WHO. I'm sorry, I'm getting a message. I know this, the GoToWebinar is a bit of a new format I'm getting. Can you see also my screen?
No, not yet. You have to accept, show my screen.
Okay, I'm trying to accept. Let me see here. Okay. Just a bit of IT challenge. Is there a sign where I should say, it says show my screen, and it's actually, I'm accepting it. I mean, I'm saying it's okay. Sorry, can you see me now?
No, we will try. Just one second.
I think it's probably from your side.
Okay, I've just sent you the request to show your screen. Yes, now we can see your screen. The browser. Can you go to your presentation, please?
Okay, great. Thank you.
We cannot
so now
see
you
your
can hear me? You can hear me and you can see me?
Yes, but we cannot see your presentation. Can you open your PowerPoint presentation, please?
No, there's no PowerPoint, Micheline. You know, remember we said it's going to be talking points.
Okay, great. Okay.
But I'll have few talking points. I will be concise in the interest of time and to make sure all other speakers have enough time. I did listen to the earlier presentation by Dr. Hala, and I think my comments will be very much along the same line, focusing on overall also health of women and the data that we have currently about cervical cancer and how can we prevent women from dying from this very this terrible disease. So first, if okay, and I know there will be some repetition, but please allow me to reiterate why do we need to address cervical cancer. I think, as you all know, around 600,000 women are diagnosed with cervical cancer every year in the world, and most of these women are, the majority of them are in their most productive years between the ages of 35 and 44. Half of these women will die unnecessarily from this disease. I would like to highlight that this is a preventable disease nowadays. This is almost equivalent to one woman dying every 2 minutes in the world. In our region, our data is not great because there's significant underestimation, but we have from 2018 at least, we have data suggesting that we lost just in that 1 year almost 11,000 women to cervical cancer, which basically it's more than a woman every hour in our region. Again, these are not just numbers. We are talking about the numbers sometimes can be impressive. These women are our mothers, our wives, our colleagues, sisters, and friends to many of us. And as I mentioned earlier, most of these deaths right now are almost completely preventable. So globally, and I've heard the last part of Dr. Hala's presentation, the majority of the burden of cervical cancer comes from low and middle income countries, where approximately 90% also of the death currently occur. So in addition to this being a really bad disease, it also shows the inequity because it's disproportionately occurring among vulnerable women who have some difficulties accessing healthcare. Our region, the Eastern Mediterranean region, consists of 22 countries in the Middle East, North Africa, the Horn of Africa, and Central Asia. We have almost 19 of our countries are in the Arab world, in addition to Iran, Afghanistan, and Pakistan. And as you know, our region in particular faces major health disparities. We have so many emergencies, etc. But even though we have some low burden countries, we have countries, as just was mentioned already, that have pretty high prevalence. And I think now that the vaccine has been available globally since 2005 almost, to most countries in the Western world. I think now, more than 15 years later, it's time for us to tackle this issue. This also, allows me to bring attention overall to the burden of non-communicable diseases overall, as we now are starting the countdown towards the Sustainable Development Goals. As you know, in 2015, the UN Agenda for SDGs included also a health goal and target aiming to reduce premature mortality from non-communicable diseases by 1/3 by 2030, and all the countries committed and heads of state committed to reach that goal. Actually, working on eliminating cervical cancer will also contribute to attaining the SDG target, and because it targets a young population that's affected by the devastating effects of this preventable disease. On maybe more specific infectious disease and scientific note, I would like to mention that cervical cancer is actually one of the few cancers that we have figured out. We know what causes cervical cancer. We know it's the human papillomavirus, and since that discovery was made, it created and led to significant innovations in vaccination, in screening, in treatment. All of these really have led to significant advances in managing cervical cancer, which is amazing, honestly. If we take a second to think about how many cancers we know of right now that are preventable and treatable, how many of those, especially in women? Very few. And cervical cancer is among the top 5 cancers in women. Other than breast cancer, mainly now cervical cancer will be one also of the most preventable and manageable cancers. So I think, and especially with the introduction of the vaccine, it offered a very important opportunity for women to be able to prevent it completely at an early age, or if not possible, to have the screening, and then even with early detection, the chances of recovery are really good. So for us at WHO, in 2018, our Director General, Dr. Tedros, set the call for action to eliminate cervical cancer, which led to the development of the global strategy to eliminate cervical cancer as a public health problem. And then we in the region built on this momentum and actually developed a regional strategy. Of course, COVID led to a little bit of delay, but we did adapted basically the global strategy to a regional strategy for cervical cancer. And we took into account, of course, the special, social, cultural, religious context of our region, all the many other public health priorities. But it did result in a regional strategy. This last October, at our 69th regional committee meeting, where all our ministers of health meet, we presented to our states the regional strategy that was developed, and based on significant consultation with our member states, it received major endorsement, which was really very satisfying for us. And this year, with January being the Cervical Cancer Awareness Month, it gave us the opportunity to formally launch the regional strategy, which we did just a couple of weeks ago on January 11th, where we had a hybrid press conference that we held in our office in Cairo, and was attended heavily by the media, by many of our key partners. And we did highlight specifically at that launch the role of the media, because I think even up till now, there is very little awareness about cervical cancer, not just among women, but about the public overall, about cervical cancer and how it can be prevented and addressed. So I think really, maybe not to repeat this, we need to mention that the strategy relies on 3 major pillars: basically vaccination as primary prevention, it is really very critical. And as you know now, WHO recommends vaccination of all girls between the age of 9 and 13, preferably. It's basically school-age children, because this is before they have the chance to be exposed to the virus. Then the second pillar is the effective screening, which should be part of a more comprehensive screening for women health. I mean, women should have their annual screening anyway, including getting a good GYN exam, pap smears, mammograms, etc. So the screening is very critical, because early detection of cervical cancer leads to almost better management and cure, so that we find precancerous lesions. And then of course the last would be the if none of those are possible, management of cervical cancer, which is the option, the least preferable. We don't want women to develop cancer. We would like to full, at least blown cancer. We would like to detect it early if possible. So basically, based on our strategy, all our countries will maintain, or will try to maintain, an incidence rate that's below the elimination threshold, which is fewer than 4 cases per 100,000. And they also need to reduce the national mortality to incidence ratio for cervical cancer. So even if it's detected, we would like to reduce the death. So we hope that the implementation of this will start very, very soon in most of our countries. Since the meeting is actually organized, it's the third Sharjah meeting, I would like to salute specifically the efforts of the United Arab Emirates, which was one among the first countries in the region to introduce the HPV vaccine in their national immunization programs. And right now we have, and this was about 2-3 years ago. We know all that it was not easy, but I think they have a very strong program in the UAE, and they persisted. And I think this is really an achievement to be highly recognized. We have just last year, actually, 2 additional countries. Saudi Arabia, the Kingdom of Saudi Arabia, introduced the vaccine last year, and just in October also last year, Morocco introduced the vaccine. Libya has introduced it a while ago. Due to the instability in the country, the program has suffered a little bit, but we also know from many other countries in the region, in particular in the Gulf, among the GCC countries, most of them have already made the decision to introduce, and it will be rolled out very soon in their national immunization program. So again, we look forward to seeing this development. We have many countries in our region, 7 countries that benefit from Gavi support, the Global Alliance for Vaccine and Immunization, which subsidize the vaccines for these countries. And we are working very closely with countries in the region, especially like Pakistan, for example, which has a very large the largest population in our region, to put an application for Gavi for this vaccine and benefit from the opportunity, because otherwise our region is really falling behind in terms of number when it comes to HPV vaccination. So last but not least, I think it's very important to highlight that the success to eliminate cervical cancer depends first on the political will, the country-led action investments, and also global solidarity, in addition to solid and sustainable partnership. And this is why I'm very pleased to see so many partners at this meeting, because commitment of the partners to work closely with the countries, especially in our region where we have so many other competing public health priorities, the commitment of partners is really critical. And last but not least, as a woman in particular, as a champion of women's health overall, I think conquering cervical cancer means a world of empowered women who are not succumbing to this disease, who are able to give their full potential to their families and societies. And to quote our Director General, Dr. Tedros, we can all leave behind a great legacy if we seize the opportunity that are within our reach now, so that girls who are born today, our girls, will live to see a world free of this disease. We are at a very critical point in time right now, and this is in our control. We cannot say that this is something we cannot act on ourselves. So I hope with all our collective efforts, we will be eliminating the first cancer in history, and then it will be something we can all be very proud of and celebrate together. Thank you very much for the opportunity to be with you. Over to you, Micheline.
Thank you very much, Dr. Haji, for this comprehensive overview. And now, please enjoy watching an awareness video about cervical cancer from my friend. And now we will take a break for 20 minutes and we will resume our forum at 11 a.m. sharp UAE time. Please stay online. Welcome again to the third Sharjah Regional Cervical Cancer Forum. We'll start with our first theme covering the topic of monitoring framework on cervical cancer, a collaborative project between Friends of Cancer Patients and UNFPA. This session will be presented by Ms. Nahla Sakr and Ms. Yasmin Baligh from UNFPA, followed by a panel discussion with our esteemed speakers. Without further delay, we would like to introduce Mrs. Nahla Sakr. Nahla Sakr has an experience for over 5 years working with UNFPA as M&E analyst, supporting the regional office and 15 country offices in the Arab states. Prior to joining UNFPA ASTRO, Mrs. Nahla was working at UN Women Egypt Country Office in the field of monitoring and evaluation, responsible for UN Women Fund for gender equality programs in Egypt and Algeria. She has a substantial experience in development and international cooperation through her work experience at the Ministry of International Cooperation in Egypt for over 8 years. Ms. Nahla holds a doctorate degree in entrepreneurship and individual development and a master's degree in business administration and a bachelor degree in economics from the Faculty of Economics and Political Science, Cairo University. Ms. Nahla will give us a talk about monitoring and evaluation framework to tackle the progress of cervical cancer elimination in the region. Welcome, Ms. Nahla, and the floor is yours.
Thank you, Micheline. Hi, everyone. Good morning. First, I would like to express my pleasure for being invited to be part of this important forum to speak about the cervical cancer M&E framework. Well, this session is about why and how the M&E framework for cervical cancer is developed. The M&E framework development was one of the commitments of the second Sharjah Cervical Cancer Declaration in 2021, which was this forum, the second forum was hosted by FOCP in partnership with UNFPA Arab States Regional Office, ASRO. The big idea behind developing it was generally to control all efforts towards cervical cancer elimination in the region to achieve a progress toward the declaration's target, and specifically to track the progress to the HPV vaccine implementation. The objectives of the M&E framework are strengthening governance and accountability of programs related to HPV vaccines implementation and cervical cancer elimination. This by conducting regular reviews to make sure that the national plans, strategies reflect the country's needs. Second, tracking the progress of countries, drawing the attention of the key stakeholders to the country's needs and ongoing efforts. Better data collection and analysis, and this like developing, improving population-based cancer registries, for example, and in addition to using evidence-based decision-making. Here are the 3 steps to the M&E framework. So first, the identification process, and that means identifying the key and main target of the Sharjah Declaration, which is contributing to the global strategy for cervical cancer elimination, identifying key existing strategies, key stakeholders, what are UNFPA country offices where the framework will be piloted, and the M&E approach, as this M&E framework needs to be complemented with other means of data collection and surveys. The second step was the development process, and this step was initiated by the M&E unit in UNFPA ASRO in coordination with our SRH Sexual Reproductive Health unit. And after having the first draft, consultations were held with FOCP team to clean up the M&E framework, to discuss the set of indicators for each and every level of results, the goal, outcome, and outputs of the declaration. Then we finalized the framework, and lastly, the usage of the framework. And here, the framework was launched late 2021, then disseminated to UNFPA country offices to set up country-specific targets and milestones. The coming few slides will show you snapshots of the framework and its elements. So, as mentioned earlier, it's based on the declaration's goal, targets, and pillars. And as shown here on the screen, the goal is achieving the global strategy target. This by reaching the outcome, improved access to screening, vaccines, and treatment, which will be realized by achieving the 4 outputs representing the declaration's key pillars: advocacy, partnership, and South-South cooperation, data utilization, accountability for results. These snapshots show the elements of the framework, so the indicators, the responsible entity for each indicator, the means of verifications, risks and assumptions. A total of 26 indicators are distributed in the M&E framework under each result level. So here is the set of indicators under the goal. So we can find, for example, national, regional HPV vaccine implementation and cervical cancer incidence by type, age, by stage, and the frequency of reporting on the indicator. For example, here UNFPA, ASRO, and FOCP are the responsible person, how this will be monitored by the surveys and reports, and so on. This is the set of indicators for the outcome. For output 1, the advocacy, partnership, and South-South cooperation, data utilization, and accountability for results. So this is a background on how and why the M&E framework was developed before distributing to the country offices to follow the M&E framework. And to conclude, the importance of adopting this M&E framework is to pave the way during this third forum to contribute to the development of a comprehensive HPV vaccine implementation strategy plan, communication strategy, so we improve the social mobilization and awareness for the prevention, screening, and treatment of cervical cancer in our region. Thank you.
Thank you, Ms. Nahla, for this comprehensive talk. And now, without further ado, we would like to introduce Dr. Nisreen Kamal, Professor of Public Health, Faculty of Medicine, Cairo. She has earned an MD in Public Health from Cairo University and a certificate on research methods for guiding policy and evaluation with special application to population and health from the American University in Cairo Social Research Center. She has significant publications in the field of population and reproductive health. She has been actively involved at national and regional level in many health research projects and conferences. Dr. Nisreen Kamal prepared the slides covering the topic of progress of the 6 pilot countries towards the elimination of cervical cancer. Her slides will be presented by Ms. Yasmin Bali. Ms. Yasmin, welcome, and the floor is yours.
Thank you very much. So as you kindly said, we are going to be presenting on behalf of Dr. Nisreen, our consultant on the progress and challenges for our Arab countries. So just a brief background, the cervical cancer is the 4th most common cancer and the 4th leading cause of cancer death in women. In 2020, there was an estimated 604,000 new cases and 342,000 deaths worldwide. The incidence of cervical cancer is estimated to be 6.4 per 100,000 women in North Africa and 3.4 in the Greater Middle East. In the Arab region, we find that in Algeria and Morocco, cervical cancer is the 2nd most common cancer among women, while in Oman, Tunisia, and UAE, it is the 3rd most common cancer among women. On HPV infections and cervical cancer, we find that only 14 types of the 100 types of HPV infections are oncogenic. 90% of them will be cleared by immunity, while only 2 out of the remaining 10% will progress to cervical cancer 10 to 20 years later. For the cognitive infections, the estimated prevalence of cognitive infections is 11.7% worldwide. The most dangerous two subtypes are type 16, which increases the cancer risks 400 times, and type 18, which increases the risk 250 times. For the prevention and control of cervical cancer, primarily through vaccines, the two subtypes, bivalent and quadrivalent. For the secondary prevention, we have the screening followed by the treatment. As for the tertiary, it's through rehabilitation, treatment of invasive cancer, and palliative care. This is a cost-effective analysis study from Morocco that shows that through screening only, 14% risk reduction will result. If we only adopt vaccination with 70% coverage, this will result in 62% risk reduction of cervical cancers. Both strategies will result in 69% risk reduction. Another study in Oman showed that the sources of information on cervical cancer was 33% from social media, while only 17% came through healthcare providers. As for knowledge on pap smears, the source was 21% from healthcare providers versus 15% from social media. Another study in Oman on reported barriers for seeking medical help for cervical cancers showed that 68% were too scared, 30% found it difficult to talk with healthcare providers, and 26.5% had problems related to accessibility. These are the causes of HPV vaccine concerns. 66% inadequate information, while 47% is related to side effects. We will have another session after this session from WHO, so they can definitely tell us more about this, but it also tells us that for WHO, they prioritize girls 9 to 14 years. They achieve high coverage rate. Prevention of cervical cancer is a public health priority, and there is cost effectiveness and feasibility. For the vaccines, these are the criteria. The two types available can be administered in 2 or 3 doses schedule. Now for the Sharjah Declaration. The Sharjah Declaration is the outcome of the 2 regional forums where representatives of government, academics, international organizations, experts, and advocates met in Sharjah in Jan 2019 and virtually in Jan 2021 to follow up on the progress and boost the national and regional response to take action towards cervical cancer elimination. The Sharjah Declaration supports the global strategy for the elimination of cervical cancer and roadmap of the 90-70-90 targets to be reached by 2030 by advocating for developing regional and national cervical cancer strategies, establishing cooperative efforts, and enhance South-South cooperation, investing in better data collection, analysis, and utilization, and by endorsing an establishment of a robust monitoring framework, which my colleague Nahla just shared with us. The commitments of the Sharjah Declaration as the monitoring framework was developed are divided into 4 in relation to advocacy, cooperation, data utilization, and lastly, monitoring. It is important that the strategic actions to achieve the 90-70-90 targets should be pursued within the framework of a national policy to eliminate cervical cancer. The monitoring framework is therefore designed to effectively track the progress on the commitments made by the key stakeholders towards the attainment of the goals and objectives in the Sharjah Declaration. The process is an initiative to ensure no one country is left behind in the process of eliminating cervical cancer, a key cause of mortality among women in the region and beyond. The framework contains key indices designed to track progress of the operationalization of the commitments and to a large extent utilize indices from the Global Strategy for Cervical Cancer Elimination and related frameworks. The Sharjah Declaration Monitoring Framework has 4 goals to achieve the global strategy for the elimination of cervical cancer, 5 outcomes to improve the access to screening, vaccines, and treatment for cervical cancer in the Arab region, and 17 outputs, with advocacy having 5, cooperation having 6, data utilization having 3, and accountability for results having 3. 6 pilot countries where we tried the framework last year were Libya, Morocco, Oman, Qatar, Sudan, and UAE. This shows the result of the Sharjah, the monitoring framework in the 6 countries. As we can see, in Libya, we had the national HPV vaccine in Libya, Morocco, and UAE. The national cancer registries are only found in Qatar and UAE. The national strategy for the screening and treatment are found in Morocco, Qatar, and UAE, while the percent of screened and treated women is only found in UAE. On the advocacy, we find that all 5 out of the 6 countries have showed progress. On cooperation, the same. And on data utilization, we find that only 4, Libya, Morocco, Qatar, and UAE, reported progress. For the goal, HPV implementation and cancer registries, we have 37%. For the outcome, access to screening and treatment, we have 33%. And on the output, advocacy cooperation, we have 55%. And this slide shows the number of achieved indicators in all countries divided by all countries' indicators. As a conclusion and way forward, the HPV vaccine in the 3 Arab countries reported the implementation of a national HPV vaccination program. Morocco started the HPV vaccination in October 2022. HPV vaccine implementation program is still under discussion in Qatar. Successful introduction and implementation of the HPV vaccine into national programs is a critical part of any elimination strategy that requires the following. For political support, obtaining political support before the implementation of the HPV vaccine program is crucial. For engaging multiple stakeholders, a resource mobilization for HPV vaccination programs requires engagement of multiple key stakeholders through advocacy and communication. We also need to ensure supply and sustainability. Additional support from international, regional, and local partners is needed to ensure sustainability of HPV vaccine supply. On advocacy, communication, and social mobilization, communities must be engaged and empowered through increasing health literacy and awareness of cervical cancer prevention services. On delivery strategy, in the absence of an existing vaccination platform to reach pre-adolescents and adolescent girls in many Arab countries, a new vaccine delivery strategy is needed. School-based programs are reported as a feasible solution. However, integrating an HPV vaccination program with existing school health programs requires the establishment of a collaborative partnership between the health and education sectors. In case of low school enrollment rates or missed vaccination opportunities, healthcare facilities can be used as settings for the dropout. For screening and treatment strategies, 3 pilot countries have a national strategy for cervical cancer screening and treatment. Morocco, Qatar, and UAE have a national strategy and guidelines for cervical cancer screening and treatment since 2011 and 2014. The cervical cancer screening guidelines are subject to review on an annual basis in order to endorse any emerging clinical evidence. While modeling has shown that HPV vaccination is not enough to achieve the elimination of cervical cancer, developing quality screening and treatment programs can reduce the incidence rates to minimal levels. Integration of screening services into existing sexual and reproductive health primary care package could minimize inconvenience to patients and reduce opportunity costs. We need to develop national cervical cancer management guidelines, establish care pathways and referrals, improve access to surgical, radiotherapy and chemotherapy services and palliative care, and provision of accurate timely data through national cancer registries. It is required to ensure high quality care. On collaboration and sharing lessons, the Sharjah Declaration Forum offers a regional hub to document and share the lessons learned during the preparation of and introduction of the HPV vaccination. Progress in the implementation of cervical cancer preventive strategies in 4 out of the 6 pilot countries is encouraging. Although challenges remain, sharing countries' experiences offer opportunities to use the shared lessons and best practices to move forward towards targets achievement. These are the references, and thank you very much.
Thank you, Ms. Yasmin Baligh, for this comprehensive overview. And now we would like to start our first panel discussion covering the topic of what is needed for successful scale-up of cervical cancer prevention strategies. This panel discussion will be moderated by Dr. Zaid Mehersi. He leads JHS Middle East and North Africa portfolio. He brings more than 15 years experience with philanthropy, government, civil society, and private sector. Private to GHS, Dr. Zaid worked extensively on HIV, AIDS, tuberculosis, and other infectious diseases in Africa and Middle East. In parallel to his public health career, Dr. Zaid has a substantial experience with media. During the Arab Spring, Dr. Zaid worked with international media to produce news stories and reports from the field. He also was a radio host and online media entrepreneur. Dr. Zaid is trilingual, a medical doctor, and holds two masters in public health from the American University of Beirut and University of Washington. Thank you, Dr. Zaid, for joining. I know it's early morning at your place, and the floor is yours.
Thank you. Thank you, everyone, for joining today. I am very excited about the third Sharjah Regional Cervical Cancer Forum. I feel like this is the best moment of the year we have to kind of regain momentum and know where we are standing as a region when it comes to HPV elimination. To remind everyone, we are one of the regions that's closest to elimination. If you look at the sort of epidemiology and prevalence of the disease, we're very lucky. We're starting from a low point, but that doesn't mean we need to kind of sort of not do the work that needs to be done to get to elimination. And we're seeing a lot of action happening since the first Sharjah Regional Cervical Cancer Forum. And I'm very excited to connect with you today to see where we're currently standing and what we need to do to kind of accelerate the work and sort of move forward faster than everybody else. So I'll start the panel, and I'm very excited to be today with our colleagues from all over the region. I am very excited to start the panel with Dr. Sulafa Abdallah. Dr. Sulafa earned her Bachelor of Medicine and Surgery in 2000 from the Faculty of Medicine of Ahfad, and we know how influential was Ahfad in shaping the future of Sudan. But also she completed her medical doctorate in dermatology and venerology in 2009. She is currently a dermatology specialist at Durman Chinese Friendship Hospital in Khartoum, but also she's the vice president and founder of Mazaya Charity Organization, and she's an active member of several dermatology societies. Dr. Sulafa, Sabah al-Khair.
أهلا صباح النور السلام عليكم جميعا.
So I will start the question with you, and then basically we'll go and discuss the rest of the situation in the region with the rest of the panelists. But I'm really curious to know from first your practice in dermatology, what's the profile of the patients you're seeing with an infection, an HPV infection?
Because in Sudan during the last years we are facing so many challenges like conflicts in different areas, instability, security instability, and even in the region. So we are seeing more cases of HPV with genital warts, and those patients mostly they are teenagers, early 20s, and even older. And in Sudan, we have movement of populations across borders from South Sudan, Chad, Central Africa, from the East, Eritrea, Ethiopia, Yemen, Syrian. Borders are open in the from the north, Egypt, Libya. So there are so many movement of people in Sudan, and in addition to the people that who are refugees, IDPs. So we are seeing so many cases of HPV.
So many cases of HPV, and
we all notice that the number of cases.
What are the options that are offered to them when they come to your practice?
Sorry, can you repeat your question, please?
I said, what are the treatment options that are offered to them when they come to the practice?
Okay, the treatment options are in the governmental hospitals. For example, here, Sudan is composed of 18 states. Khartoum is the capital of Sudan and is the most well-established compared to other states. So we have the main dermatological hospital here in Khartoum Teaching Dermatology Hospital. We have facilities like we use, for example, liquid nitrogen, cauteric, and we recently there is no availability of laser devices to treat such patients, but we used to have, but nowadays they are no more. They are no longer working. And even we also botulinum is one of the modalities of the treatment.
Thank you, Dr. Sulafa. So from your regular dermatology practice, you ended up founding Mazaya Charity Organization. Can you tell us more about the organization, the services you offer?
Okay, Mazaya organization, the idea started as just we are colleagues, doctors, working at governmental hospitals, and we are just the idea by to help needy patients in medications, searching our colleagues to treat such patients who need surgical operations, offering of drugs. Then we are noticed that our initiative was growing. Then we founded Mazaya organization in 2016, and then professionals from others joined us, engineers, teachers, even housewives, and in Mazaya for the main health project, Since 2019, we work on cervical cancer screening community educational program. This program was funded by the Italian Agency for Development Cooperation, and we were in two phases because here in Khartoum State, there was a well-established screening unit at Sobo Hospital. It's one of the main hospitals in Sudan related to the Ministry of Higher Education and Research. And people were not using this available screening services, which are for free. So this was our role in Mazar organization to raise the community awareness. And after that, we started to review the impact of our work, and we found it that the number of women who get screened within 4 months from our start of our awareness campaign was equal to those women who were screened for the last 2 years or previous to our awareness campaign. Then we shifted to phase two because our Khartoum state is big, and we were facing economical crisis, protests, and the political instability. So what we did in Mazaya, we provided 2 more screening units at 2 primary health centers, one in Bahri locality and the other one in Khartoum locality. Also, this was funded by the Italian Agency for Development Cooperation. Now, we are continuing on our awareness, and also in 2023 this year, and for the next year, we have a project which will start in February, will be for 2 years for breast and cervical cancer, will be in Khartoum and Kasal state in Eastern Sudan. Because one village who, the women who screened there, about 74% of women were positive to precancerous lesions. So there is a high prevalence rate. So we have to work more on the raising awareness. Even we have trained doctors to do the VIA test for the family medicine doctors who are working at the primary health centers, sisters, midwives, and medical officers. Because after our project phase is finished, then because we are seeking for the sustainability of the project, now the second phase finished almost 6 months ago, but those who were trained, who are working, they're basically working at these health centers, are taking on the work of doing the screening. And this one part of Mazaya. Also, Ina Sarabtamis, which is an international women organization. And recently, we have a collaboration with a club in Dubai. And also we are working with them to target, or our title is the elimination of cervical cancer in Africa. And Health for Life Fund is for several countries here in Africa, and we support this work with Dubai Club of Sarabtamis. May work here may start in this year, at the first half of this year.
Wow, thank you. This is a very comprehensive explanation of actually what constitutes the patient journey in Khartoum, and also particularly in Mazaya charity organization, the added value it brings through this international projects and cooperation. From Dr. Sulafa, I'm going to go to Dr. Aida Al-Awadi. I think I'm still interested in the patient journey, but I'll introduce Dr. Aida first. Dr. Aida graduated from the United Arab Emirates University of Al Ain. She completed her residency in St. Vincent Hospital, affiliated with the University of Massachusetts in Worcester. She recently completed the fellowship training in hematology oncology at MD Anderson Cancer Center. And while at Anderson Cancer Center, Dr. Al-Awadi published a number of peer-reviewed articles in international journals and presented abstracts mainly in breast cancer. She presented in US national meetings, and she also wrote multiple book chapters mainly on breast cancer. Dr. Aida, we just heard the patient journey in Mazaya and in Sudan. Can you walk us through the situation at Awam Hospital?
Yes, absolutely. First of all, I would like to thank you for inviting me, and thank you for this lovely introduction. Dr. Sulafa, thanks for all the work you put for cervical cancer screening and management. I'm really so honored to be with you in this panel, and I'm sure like you're helping a lot of patients in Sudan and there. So thank you again, and hope we can collaborate in the future as well, and with the rest of the panelists as well. So for me, cervical cancer, of course, in the UAE, it's the 7th leading cause of cancer in both genders. And then in terms of mortality, it can go up to 5th most common cause of, mortality, cancer-related mortality in the UAE. And Awam Hospital, actually, 7 most, per the data registry that was recently published in 2021, it was the 6th most common cancer diagnosed. But we still, there are other cancer that we see more commonly, including breast, colon cancer, and such. So for cervical cancer, I mean, we've been very fortunate with the introduction of the HPV vaccine in 2018 in our country. And of course, with the first introduction, there has been a lot of, a lot of questions and a lot of like dilemma of like, why should we get it? And there was a stigma basically around it, as you would expect, culturally. But I think we've gotten better in terms of like education, and we know a lot of, education, and actually the number of people vaccinated, which initially started at 40% to the age group, we are up now to 70%. So that's impressive. And as a matter of fact, not only in Awam Hospital, but in different parts of the country, there are well-documented data that the incidences of cervical cancer has been, declining. So that's in different institutes. We've noticed that. Now, the good thing about it is also we are seeing more and more patients diagnosed with early stage. As a matter of fact, in my institution, like majority of the cases will be early stage, and then maybe 10% or less will be the metastatic patient. The patient, from my experience, has been educated tremendously about the early signs and symptoms of, cervical cancer. You can see it across the country, different campaigns, different, campaigns, a different approach. Now, the screening might not be free for all the patient, but there are definitely charity-based screening, like charity can provide it, and then a lot of institutions will provide it also for free during the January or the cervical cancer month as an initiative to early diagnose the patient or during the precancerous state. Now, in my facility, we are also linked to an ambulatory healthcare system, very effective. We have something called the Women Health Clinic. So we don't look at the woman only from the cervical cancer perspective. No, it will go through the bone health, the hormonal health, the different aspect. And one of the major things that we do for these patients is educate them about HPV. HPV vaccination if they qualify for it based on the age group, and then of course whether age group, and then the screening, of course, for our married females. So we do that, and they have very good access to it, and the numbers of patients accessing these women health clinic has been increasing by the year, just because of the educational campaign that we put behind it. So more patients are screened. We are detecting more and more early stage, disease, and the HPV vaccine has been improving, and that is all from educational. Now, that is from the community and the hospital perspective, but we as an individual, as a medical oncologist, also have the responsibility to educate my patient. So we have a lot of survivors in our clinic, like breast cancer survivor. You see that my maybe expertise is more in breast cancer, but I do still treat patients with cervical cancer. So majority of our patients are survivor. We give them treatment, they are cured, and now they just follow up without treatment. One part of the survivor track, and per the guideline, is to keep the patient up to date to measures to prevent cancer and also for early detection of cancer. So one of the main things, we don't also focus on breast cancer and how you are doing with your medication and when is your mammogram. No, we tell the patient you do have to do your HPV screening. If they qualify for the age, get the HPV vaccine, but most of the patient will be older than that. And then we also the colon cancer screening and all such. So we individually, we can do it this way. And I personally also have been involved in many campaigns for cervical cancer awareness and screening across the country. I'm also part of the Emirates Oncology Society, and we have, been involved heavily with different organizations to promote the benefit of screening. So I think all of this effort we put together, as Dr. Salafa said, to make it reachable and accessible for our patient and to increase education and increase the early cancer detection.
Thank you so much. This is so interesting, and I have so many questions. But I'm gonna bring in Dr. Maysoon and Dr. Maribel into conversation, and then I'll come back to you, Dr. Salafa and Dr. Aida. Dr. Maysoon, I know you as someone who sort of has been a champion of prevention in the region for a very long time now. Just for those who don't know Dr. Maysoon, she is currently a regional director of vaccine policy in the Eastern Europe, Middle East, and Africa region. Dr. Maysoon has a great interest in public health initiatives. She's working on vaccine hesitancy, improving health system resilience and health equity. She is also actively involved in diversity and inclusion activity and very keen on women empowerment. She is currently the Global Women Network co-lead at MSD. But more importantly, I think she's someone who has been really at the first row of the prevention fight that's happening not only in the UAE, but also throughout the region. Dr. Maysoon, can you tell us about sort of like the different activities and the different sort of initiatives you're seeing in prevention in the region?
Thanks a lot, Ziad, for the nice introduction. And first, I'd also like to thank Friends of Cancer Patient and UNFPA for bringing us all together again to continue the discussion on cervical cancer in the Middle East region, which continues to be a global health concern. And as we've heard, it continues to be a concern in our region as well. I'd also like to acknowledge my fellow panelists and the work we've heard about in both Sudan and the UAE. Let's not forget that, around the world, and we've heard this number, a woman dies of cervical cancer about every 2 minutes, and maybe even every minute in our region. I think you've talked about my passion, Ziad, but what really drives this passion is that these are mothers, these are sisters, these are the daughters and friends of a lot of us, women we know, women we love, and who have people who love them and need them in their lives. So thankfully, we can prevent cervical cancer with the joint efforts of primary and secondary prevention, as we've heard from Dr. Aida, both with vaccination and screening. And there's a real opportunity to eliminate cervical cancer as a public health threat with the screening, with the treatment, and with the prevention as well. And it's great to see today what we've heard from WHO EMRO about the rollout of their strategy for cervical cancer that's specific to our region, that's specific to the needs of our region and to the particularities of our region. What is even greater is the call to action and the monitoring framework that we've just heard about to elevate the momentum around cervical cancer. However, we heard that the region has still a lot of significant work to be done. And that's why, to be able to achieve those targets, we all need to work together. And what my view on this is that first, we need to build robust and sustainable cervical cancer prevention programs. This is where strong cross-functional governmental leadership is essential. The decision makers need to continue incorporating support for prevention, continue driving the momentum for treatment, continue elevating the awareness and care for HPV-related cancers into the national health programs, and also ensure that the necessary infrastructure is in place to support those prevention programs. We've seen the data from some countries around the world showing that HPV vaccination programs that had started years ago are already showing the impact, reducing cervical cancer, precancers, and other diseases in countries around the world that were early adopters. And in the last few years, what we've seen is that scientists, public health stakeholders, country governments, policymakers, patient organizations have come and united around the globe around the first goal of with a passion for one day to eliminate cervical cancer and even other HPV-related cancers. This goal really compels us all to act collectively with a comprehensive approach with screening, vaccination, and treatment. The tools exist. We just need to increase awareness and access to both screening methods and vaccination. Second, I believe countries should also consider the most applicable delivery strategies, as we heard from the previous speaker, based on their country infrastructure, their current systems, the local needs, and the available resources, which includes vaccination at schools, healthcare facilities, community-based outreach, non-clinical sites, or a combination of approaches. School-based vaccination, as we've seen, has been considered a very effective approach, as it really facilitates access to the target population, who are the adolescents. In our region, we have seen the success of the UAE and the recently launched Saudi programs as they implemented their school-based programs and achieved very high vaccination rates. School-based strategies are also an opportunity to collaborate with school health programs and health where they exist, and this could be offering a bigger portfolio to integrate public health messages within schools as well. I'd also like to mention public awareness, which is key, and we've also just heard it, that it's very important to improve communication efforts and strengthen the ties between health actors and community members to ensure increasing awareness and delivering the correct messages about cervical cancer and about vaccination and screening. And my final remark is addressing that the burden of HPV-related cancers will require sustained commitment and coordinated research and action across multiple stakeholders to deliver those comprehensive screening, prevention, and treatment programs. Countries should really consider the need for proactive long-term financing to support elimination programs, strengthening their healthcare systems, and ensuring the ability to deliver the products and services so that we can all work together to advocate for elimination and reach the targets we are aiming for.
Thank you so much. I think this is what I wanted to hear, and I think, to be honest, seeing the region starting several prevention programs, particularly when it comes to vaccines, and exploring sort of different paths, I'm really hoping that we can learn together and sort of apply the gold standards when it comes to vaccine implementation. And I think particularly school-based programs have proven themselves. So I'm hoping that we actually can get there very quickly, because I think it does not only take the courage to start the vaccination program, but you have to start it the right way in order to ensure the coverage rates that Dr. Aida was mentioning earlier. Dr. Maribel Almonte, I'm going to bring you into the conversation because I think you represent an international organization. For those who don't know Dr. Almonte, she is a Peruvian cancer epidemiologist with extensive expertise on cervical cancer prevention research. She is the principal investigator of the ESTAMPA study, evaluating techniques and strategies for HPV-based cervical cancer screening across Latin America. She co-leads the CESTA study comparing HPV screening and treatment with and without triage in Africa. She joined the International Agency for Research on Cancer in 2013, 10 years ago, and is now spending 1 year at WHO HQ to work at the Cervical Cancer Elimination Initiative, leading the update of cervical cancer screening and treatment guidelines and implementation research. Dr. Almonte, I was speaking about gold standards. So in order to go to the topic actually of this panel discussion, what's needed for successful scale-up of cervical cancer prevention? What are the gold standards and what should we do in the MENA region?
Good morning, everybody. It's a pleasure to be here, and I will actually echo my previous panelists to say that I'm very pleased to see and to hear about the experiences in each of the countries and the programs that have started in the region itself. And furthermore, I'm very pleased to see that the panel is composed of 4 women, which I think we should actually be very happy about it. I appreciate it very much. So I just wanted to start by saying that we should not forget that the elimination strategy is composed of 3 pillars. The first one is the vaccination. The second one is the screening and treatment. And the third one is that we should achieve the 90% of management of all cervical cancers. I don't have to repeat the figures of the region or the burden of disease or any of that, because I think you all are very much aware of that, probably better than me. But what I wanted to say is that currently the WHO guidelines for screening and treatment that were released in 2021 recommend to use HPV testing as preferred methods of screening in comparison to visual inspection or cytology or any other screening type that has been used before. However, we are very conscious that this demands a lot of efforts, investment, preparation, planning, many things to go on. The reason I mention this is because it is important to recognize that if we use HPV testing, the chances of women left untreated and probably developing a cervical cancer late in life are very small compared to other screening tests that are available. So I would suggest that at some point we start thinking of moving towards HPV testing, not now, not tomorrow, but as soon as our countries are ready to do it. With regards to, so those are the standards right now for HPV screening and treatment. But for HPV vaccination, I'm sure you've heard enough about it, and I know that using a school-based approach is one of the best approaches to ensure coverage. But we should also think about sustainability of any program that we start. So we need to plan it accordingly to our own installed capacity in the country, and we have to work to increase the capacity as to make any of the programs that we start very sustainable. So I also wanted to mention about invasive cervical cancer. We should somehow be aware that as we do screening, there will be several cancers detected. At early stage, we hope, as mentioned before, but still these cancers will require additional treatment that we need to have in place in the country. I really welcome all the ideas that you presented, all the programs, all these cancer awareness that you are all working in, which I think is one of the main steps through what we do every single day. And I also welcome the different approaches, like having a women's clinic, checking for all cancers, etc. And I think each country has the capacity, and if you need some support to go on and plan, we are ready to help you. I mean, we will try to help you as much as possible. But I think each country should plan their own strategy to actually move towards the goals for 2030 on the Elimination Cancer Initiative. I also wanted to mention that under the research spectrum, we are actually we are awaiting results from many other things, in terms of technology. Dr. Abdallah mentioned that they've used thermal ablation at some point, but there are not enough thermal ablators, for instance. And we will be working on that, on trying to, with other partners, international organizations, to try to facilitate the procurement of these thermal ablators, so that they are enough in a country if you are going to go through that pathway. And technology evolves. So now we are talking about visual inspection, for instance, or 20 years ago, we were talking only about visual inspection. Now we talk about HPV DNA testing. Tomorrow we may be talking about something different. And even within the spectrum of each of these approaches, technology evolves so quickly, and we need to be, on track of that. That doesn't mean that we have to change our technology or our platform or what we decide to use immediately, but that we should prepare to look for all the time more efficient ways of offering both the vaccination, the screening and treatment, and the, let's hope, less and less treatment for invasive cancer. So we are working on a number of approaches and technologies like self-sampling, for instance. We plan to do a very large evaluation of self-sampling used with HPV testing at different scenarios, etc., in the coming 2 years. And we will hope to give you some more answers and some more options to be used within your own context and under your own selection and using what you know about your country, what you know about your population, and then try to gather the best option for yourself and the one that is going to make your program, whichever you decide to start with, whichever you decide how it's going to be, make it more efficient and with high likelihood of being somehow sustainable. Thank you. That's it.
Thank you, Dr. Almonte. I stay with us. I'm going to go back to you with a couple more questions, but I want to go back to Dr. Sulafa. Dr. Sulafa, we just heard a lot of options that are out there that are currently not implemented in Sudan. My question to you, and given what Dr. Almonte said, you get to choose what program works for you. I would love to hear from you. What do you think are the next steps, and sort of what are the next changes that you want to see implemented at policy level in Sudan, but also when it comes to your organization, to Mazaya, I would love to know what are sort of the next phases of your projects and how to move it to the next level. I think you're on mute, Dr. Sulafa. If you could unmute yourself, maybe. I'm not sure if I'm the only one not able to hear you, but can my panelists confirm, or are you able to hear Dr. Sulafa?
Now we can.
Okay.
Now, do you hear me
she's
now?
with us.
You hear me?
Yeah, this is perfect.
Yes.
Okay. Hello. Okay. Here in Sudan, the cervical cancer really, unfortunately, is considered as a neglected public health problem. We don't have a current program for HPV vaccination, nor coordinated screening and cancer management of efforts. For example, no coordinated screening, we have only 5 colposcopy units, and they are dealing with cervical pathology other than cervical cancer. And for the treatment of precancerous lesion is not available now, even comb biopsy or radical hysterectomy. At this point, we have only one here in Sudan, gynecological oncologist, who is practicing in a private sector. And there is no gynecology oncology subspecialty training program in Sudan. At this point of management, we really would like, even through Medaya, or to expand the workforce capacity through long-term strategy for surgical education and training, as we consider it is a key to nationally scale up the organized gynecological cancer treatment in Sudan. We have, even in Mazaya, in our members, we have an obstetricians, and they are really interested to join this gynecological surgical education or this part of training, because even those have earlier lesions or discovered with early cancer, they don't have the proper management. Also, for the chemoradiotherapy services, just available in 3 states. Sudan has 18 states, only in 3 states the brachytherapy is available. Regarding the palliative care services or drugs for pain management, is not officially available. And after all of these challenges, the promising thing is that, or some things that may appear, because the Mother and Child Health Department, as the Federal Ministry of Health, now they are committed to issue a national strategy to reduce the burden of reproductive health cancers. And even for to know the specific genotype of HPV here in Sudan, as I mentioned before, the movement of populations from around the region here in Sudan, always people are moving. We really need more researches to know specifically which are the genotype of HPV, which are more common here in Sudan. So we need more researches in HPV, and also the availability of the screening methods as a prevention. Previously, we tried to have a common research with Vilnius University in Lithuania, but our limited resources, it was a research in 2018 and 19, and it was a multi-central research in different countries all over the globe. But one of the main issues to be partner in this research, to use the pap smear to be investigated, but not manually. Here we are using manual cytology. So we need to, although now pap smear, as Dr. Marble, she mentioned that people are now moving towards an HPV is to be the main method for screening, but according to our resources, now VIA is more practical, and although it's cheaper, but it was not considered as a public health problem by our stakeholders. So some different initiatives from us and others to train the junior doctors, because also in Sudan we have the major problem of the high turnover of medical cadre to outside Sudan. So we are now focusing on training the junior doctors who will, because of to complete their specialty journey, they should be at least for 5 or 4 years here in Sudan, and they are moving around in the different states of Sudan. So this is one of our strategy to train more junior doctors and other health cadre to do the VIA test. And also, as Dr. Marble said, we consider that we recently now we do need more gynecology oncological training.
Thank you, Dr. Sulafa. It's a long list indeed, but I'm hoping that people are listening and that we can sort of.
But I think that
I will go back to Dr. Aida, but I want to just have a reaction from Dr. Almonte and see basically what are the from the menu of options that are out there. What else do you add, or what else do you think is important for Sudan to consider in terms of options for prevention and treatment, as Dr. Sulafa has mentioned?
So 2 things to say. The first one is like, I've listening to you, and I've seen all the projects that you've been working on through your organization and your personal engagement as a dermatologist. And I welcome that very much. But I would like to take back the words from Dr. Maisunlulu, because I think the most important part now would be to incorporate or to plan in, or to have a national cervical cancer control program, and you have to plan that, and you have to make it, like according to your own context. That's the first thing, because otherwise, as you say, there are many efforts, small efforts, probably very uncoordinated, and we would like to coordinate them. And it's not a problem to use visual inspection right now. You just prepare the platform to move into HPV, but you need to have the platform. And for that, actually, there should be coordination of all the efforts. Now, what I would suggest, I mean, in an ideal world, I would like you to use self-HPV testing followed by thermal ablation of all HPV positives. That would be my ideal world, but I'm conscious that ideal worlds doesn't usually are there. So we have to go step by step. So I think I heard you, and I think one of the most important things now would be to go on into the training, into build up the capacity to offer treatment, both at the level of pre-cancer and at the level of cancer as well. And for that, again, the first things to do is to have a national or cancer control leadership, like that coordinates all the efforts for you to go on. And I think that's the most important part. And then, like maybe 5 years down the line, we have some sort of artificial intelligence that will help us a lot more. And then you would already have all your people trained to apply that. But you have to work on that part first, and to guarantee that any woman that is unfortunately diagnosed with cervical cancer, invasive cervical cancer already, it's able to receive treatment. The other thing I wanted to say, given that I have 1 second more, would be to say that it is important that as a region, we support each other. So other countries in the region probably can actually help you sort out your program, or can actually support you in dealing with the cancer patients or so on. Or on the training, like you can support each other, having some sort of training mobilization for people to train in a short-term period or in the medium term period, to get all the capacity, or at least certain capacity that. I'll stop there because I think we have a lot of more questions to address, and I'll pass it to our wonderful moderator. Thank you.
Thank you, Dr. Almonte. Maysoon, I would love to hear your thoughts in terms of like the options available for countries with limited resources like Sudan. Now we know that we have enough vaccines to offer to all these countries, but how do we get them there?
Thanks, Ziad, for the excellent question. Well, certainly there's a lot of opportunities for support. We as a vaccine manufacturer have recognized that the call to action had created a lot of demand, and have responded immediately with a huge investment to improve the supply. And we do have an improved supply situation. Now, what we're working with countries is to ensure, countries develop their strategies for cervical cancer control, whether it's prevention or screening, in addition to improving awareness. For a country like Sudan, we continue trying to discuss what are the main stakeholders involved, and to ensure that we also are in discussions with other collaborators like UNICEF and Gavi to ensure that countries improve their access to those innovative opportunities to be able to control cervical cancer. So what we've learned is that the importance of various stakeholders working together, I believe, specifically when we talk about cervical cancer, and being here in hosted by a critical patient organization, it just shows us the real importance of civil society being involved in those strategies. And what we've heard from Mazaya in Sudan and from the previous talks about the work Friends of Cancer Patient Organization and UNFPA, this really stresses the importance of various stakeholders working closely coordinated in a coordinated approach to continue, I would say, planning together and implementing successful prevention strategies. When considering those strategies, I believe it's always very important to consider the various stakeholders to be involved, whether it's women's health, cancer control departments, health advocates, community leaders, media. We've just heard about the very important role of media can play in ensuring the awareness and the spread of the correct messages. We know there's a lot of misinformation that has been spread about, the HPV vaccination in general. So we want to ensure that media plays a critical role in delivering the correct messages, especially with the great outreach of social media. So this multi-sector collaboration is critical as countries plan, and there's various discussions, as I said, for us to work closely. And finally, very important to consider is the importance of public-private partnerships as we address public health issues and continue the discussion on implementation. Two major areas of collaboration are data generation and public awareness. And finally, I would say every one of us has a role to play so that we can ensure that no girl or woman is left behind when it comes to being controlled against cervical cancer.
Thank you. Thank you, Maysoon. Dr. Aida, Abu Dhabi started vaccinating on HPV in 2008. The UAE joined it in 2016. And yet I was glad you're specializing in breast cancer, because I was thinking by 2023 there will be no more cervical cancer in the UAE. Now the question is, how do we get there? How do we get to a day where you don't see a single case in your practice? What do you think is next for the UAE in terms of elimination?
Yeah, so again, very important question, and I would definitely share some aspects or challenges. We do share it with as with other countries like in Sudan and and other countries across the world. So definitely there are many things that we can. I think that we reached a very good milestone, but there is a lot of work to be done because we still see a good number of patients. I mean, we don't even want to see early cervical cancer. We don't want to see it at all. So that is exactly what we are. So I just heard Dr. Maysoon say about the power of media. Yes, media can be very, very powerful, because a lot of times when something goes into the Instagram, I will get a lot of patients, coming back to me, Doctor, what do you think of this? Do you agree with this or not? So a lot of patients now, they have social media, they spend a lot of time on this social media. So we need to use this platform to raise awareness. It's very powerful. I mean, we cannot underestimate the power of it. So definitely. And at one point I heard of some organization who trying to put the message, in the movie theaters just before the movie begins. So a lot of, that's a very interesting concept. So there's a lot of, ideas that we can utilize through the media. The second thing would be, I mean, you may not agree with me with this, but I think it has to be, the HPV vaccine has to be compulsory. We have for both females and males, because we know for sure that it is the only vaccine that has the ability to prevent cancer completely. So I think it has to be compulsory. I don't think it's compulsory yet in the UAE. I mean, they still have to consent to it and such, but I think it has to be compulsory because we are preventing something that is very, dreadful too. The third thing will be accessibility to get vaccines. So vaccines are not cheap in the UAE. I mean, luckily our Emirati females and male, they can get it for free, but I mean, we are only about 10% of the population. How about the rest of the population? A lot of these insurance plans either do not cover for it or have some co-payment for it. So I think, you know, by the end of the day, we are trying to prevent a disease which may be more burden on the patient and then financially as well. So we have to improve it from the prevention level. So I think there's a lot of discussion and talks that has to go through different government and organization and insurance policies. That's very important. And then accessibility to screening, we are doing better and better with that. I don't think it's something, you know, a high burden in terms of, you know, the financial aspect, but still, if we can provide a way where all female patients can get screened for free, that will be the best thing. I know that, again, Emirati ladies, they can get it for free, but again, different insurances might find it, you know, the coverage may be difficult. But luckily, from my experience with many of my patients, a lot of insurances will cover for it because they understand the role of screening. So I think we have to reach through the media, we have to reach through the governmental, you know, authority, the medical authority in there that put policies in terms of like immunization, vaccination, and then also to educate and then also to basically the accessibility to screening, improve the accessibility to screening. I think with that, if we work on these three things and we united the effort, yes, I believe that we will cut down tremendous. I mean, because believe it or not, still we are seeing some, you know, cervical cancer that are not HPV related, very rarely, but I think we can cut down at least the HPV related, maybe 99% of these, you know, of tumor that we see in the clinic. Yes.
Thank you, Dr. Aida. A lot of food for thoughts for Dr. Almonte and Dr. Lulu. So I think before I go back to a final reaction from both of them, particularly on the making vaccine compulsory for both boys and girls, Maysoon, I would love to hear some final thoughts from Dr. Sulafa Abdallah, given what the feedback was from the different panelists regarding the situation in Sudan. Dr. Sulafa, any final thoughts?
Do you hear me now? Comparing breast cancer to cervical cancer in Sudan, the situation is not comparable, because awareness activities regarding breast cancer in Sudan started a long time ago. Even the professional training for surgical management of breast cancer patients also improved, and even the survival of breast cancer patients now it's became comparable to other African countries here in the region. So we have to work more on cervical cancer. We really need more collaborations with different institutes. And also I agree with the role of the media, and we had started this recently to work through the different platform of social media to attain the attentions of others. And finally, I really appreciate this highly informative discussion, and really thankful for being one of the panelists here in the South Sharjah Regional Cervical Cancer Forum. And we are looking forward for more collaborations, more activities, and to finally reach our goal to eliminate cervical cancer. Thank you for all of those who are working on this really important forum.
Thank you, Dr. Sulafa. I'll go to Mrs. Maysoon Lulu and actually ask you a direct question. Where do you want to see the region in 2024? We're in the early 2023. We have 2 years in front of us. The regional strategy of WHO has just been launched. Can you tell me where you kind of hope to see the region in 2 years from now?
Well, I believe we are a critical region, and yes, with the launch of the WHO elimination strategy, there's a lot of promise to continue building the momentum. What I would like to see is more collaboration between the various sectors on the topics where we can collaborate to ensure that there's increased public trust and confidence, and this is something that really policy makers can focus on to increase the public trust. So while they're planning the rollout of their programs or their elimination campaigns, they can really work on also building that trust by ensuring access to correct information, openly communicating about their plans, about whether it's screening programs or vaccination programs, and rapidly addressing any hesitance issues that may occur while they are planning their communication plans. So public trust and confidence is critical, and this is really where, as civil society, as the private sector, as healthcare professionals, as epidemiologists, we can all ensure to work together to ensure that misinformation is tackled. And then, once vaccine programs are implemented, or cervical cancer prevention strategies in general, specifically with respect to screening and vaccination, have been implemented, we can ensure that people are actually coming to get the vaccine or actually going to be screened. Now, as we saw, we have 4 active programs in the region. Certainly, I believe every girl between the age of 9 and 14 deserves to be vaccinated. So every girl in our region deserves to have access to the vaccine. And it's, again, the collaboration between the various sectors that will ensure we achieve this to ensure that there is successful rollout. We as industry are important in the discussion as we work with policymakers to find the actual access solutions, and we are counting on collaborators like the healthcare professionals, like civil organizations, to ensure that there is momentum. We continue working with the various stakeholders to maintain that momentum, and congratulate again the WHO EMRO on ensuring that there is a strategy specific to our region, a strategy that will continue building that momentum. And we look forward to the various discussions to ensure, again, addressing the data needs, addressing the education needs, the communication aspects as well. And I really hope that when we come back for the 4th Sharjah Regional Cervical Cancer Forum, we will be congratulating each other on more programs in the region with respect to cervical cancer screening and prevention as well.
Thank you, Mrs. Maysoon Lulu. That was very inspiring. Dr. Almonte, WHO has put cervical cancer front and center, first with a global strategy that was launched in the last years, and now we're seeing that the regions are starting to implement their own regional strategies. You are one of the lead policymakers globally on this topic. What are the next changes we can hope that could come within the next guidelines that could help countries like Sudan fast track the sort of elimination agenda?
Yes, thank you. I would like to start by saying that, again, from when I started my first intervention, we should not forget that there are 3 pillars. And I think the HPV vaccination is super important. And the possibility of offering, as Maysoon was saying, of having every single girl aged 9 to 14 being able to be vaccinated against HPV infection, it should be the main target, and we should all work together to make that happen. That's one thing. With regards to the novelties that are coming in 3-5 years, we are working in different topics. We are working, as I mentioned before, on the use of self-sampling straight away, and that will take time, of course, because we first have to prepare, or we will have to have the capacity to use HPV testing in screening, but we will actually work on developing strategies that incorporate self-sampling to actually make the uptake of screening larger, because it definitely facilitates the attendance to screening by women. They accept it very well. Health workers also accept it very well. It is accurate, but we still need to work out how we will use it. I think another point that we really want to start focusing, or that we will expect some results in the next 24, 36 months, are all the issues related to artificial intelligence that will help us both diagnose and triage women who are HPV positive or VIA positive, or actually decide on those that are eligible for an immediate thermal ablative treatment and those that actually need referral. So I think those are the two main things that are coming like as big topics, but we also have to consider that there are different technologies, like the improve of molecular testing is ongoing, the improve of having tests that are next to the clinic, like point of care, near point of care, the improve of the current thermal ablators, for instance, whether they incorporate a camera or not, whether we can use them faster, etc. And in terms of vaccine, and I know Masoom knows this better than me, there's the possibility of having more availability, like not being that, because at some point we didn't have enough vaccines around there for all women, but this may be changing this coming years. So there will be some sort of offer for at least to cover some of the demand. And I think all these novelties will come together in the coming 2 to 5 years, I would say, and we should all be prepared for this. This is what I think, starting a program and setting the platform from what we are doing now to be ready for when new things come, and we can even make our programs more efficient and move faster to our goals. That's what has to be our key issue. Thank you.
Thank you. There is nothing better than innovation to give us hope that we can overcome. And I think the region is sending very strong signals that change is on the way. And it's only with inspiring women like you all that we can get there. So thank you so much for this great conversation. Thank you so much for all the work you do. And I look forward, as Maysoon has said, to meet you again 2 years from now and see where we will be landing. But thank you so much for the work, and thank you for all the organizers for having put together such a great panel. Thank you for all of those who listen to us, and I look forward to more exciting sessions ahead.
Thank you, Ziad.
Thank you very much.
Thank you. Thanks a lot.
Thank you.
Back to you.
Thank you all panelists for all those strategies, insightful strategies to tackle cervical cancer and save countless lives. Now we will move to our second theme, covering the topic of WHO Regional Elimination Strategy for Cervical Cancer. We will have a talk done by Dr. Lamia Mahmoud from WHO, and another talk with Dr. Mohammed Afifi from WHO as well, followed by a panel discussion led by Dr. Nassim Pourghazian from also WHO. We will start now with Dr. Mohammed Afifi. Dr. Afifi is a qualified medical doctor and international health expert who has acquired diverse academic, research, and field-level experiences in the areas of women's health, health systems development, health policy and diplomacy, and a maternal and reproductive health in the Arab region. Dr. Mohammed has 2 master-level degrees in international health and in health systems research and development from the UK, and over 20 years of experience working for government, academia, NGOs, USAID, UN, and WHO. Dr. Afifi led and coordinated the development of several regional analysis, frameworks, and strategies, including the Regional Arab Multi-Sector Strategic Plan for Reproductive Health, Maternal, Child and Adolescent Health, and the Regional Arab Health-Friendly Budgeting Strategy. Dr. Afifi will give us a talk about embracing a women's health lens in support to cervical cancer elimination at a perspective from the East Mediterranean region. Welcome, Dr. Afifi, and the floor is yours.
Thank you very much, Micheline. Good morning, good afternoon, good evening, colleagues, wherever you are on our little blue planet. My presentation today is about, as you see on the screen, healthier women by 2030, which is by embracing a women's health lens, as Micheline mentioned. Why are we putting 2030 here? Because it's the end timeline for the SDGs, the Sustainable Development Goals, and a key ingredient of the SDGs is to focus on women's health and empowerment and their contribution to having a healthier planet by 2030. Every 2 minutes, we experience a tragic incident in the whole world, and this is the death of a cervical cancer case. And every 1 hour, again, the unfortunate incident of the death of a cervical cancer case in the region. So let's do the math together. Since we started this session a couple of hours back or more, how many women have lost their lives to cervical cancer, which is largely preventable with the technologies that we are having, with the vaccines, with the screening facilities. It is largely preventable, but those women have already lost their lives to cervical cancer. Another tragic incident happens every 4 minutes, and this is the diagnosis of a new cancer for the breast in EMR. This is the region, East Mediterranean region. Sorry for those who are not familiar with the acronym. So every 4 minutes, we have a new case of breast cancer. And every 11 minutes, we lose a woman out of those who were diagnosed with breast cancer. These are very sad news, but the good news is that we can do something about it. Together, we can, as we will see in the coming slides, the approach that we are advocating for. I'm sure several colleagues on the call know the city that I have put on the screen now. It's one of the famous cities in the region, in the East Mediterranean region, or the Arab region, or the Middle East, North Africa. It has several names. But do you also know this other city that I showed on the screen, on the left side of your screens? These two cities are cities within the region. And it shows that we are a region of extremes. And it's not only about buildings, it's about health of women. The Mediterranean region, the East Mediterranean region, is very much, unfortunately, challenged with those diverse settings, but indicators that we have for the different women's health aspects confirm this. For example, the maternal mortality has a very wide range. It goes down to 3 per 100,000, which is very comparable to the most advanced and developed countries. And it goes up to more than 800 per 100,000 live births. You see that we have really very extreme ends of the spectrum. When we look, for example, at anemia among women of reproductive age, we'll see another stark difference. It goes down to 27% and up to around 70%. And let's put this 70% into perspective. It means that for every 10 women of reproductive age that you get to see in a day, for example, 7 of them would have anemia. Another one, it's about life expectancy among women. It goes down in some countries to 57 years of life expectancy and up to 82 years, which displays a 25-year span of difference. And I recall here Professor Sir Michael Marmot, the famous figure on health inequities, who was a global leader of several global reports that address inequities and health. He was saying that when he takes his bike across London, where he lives, women start losing their lives when he moves from a district to another district, because they estimate that maternal mortality, for example, in District X is higher than district-wide, so women lose their lives when he crosses the borders of those districts or cities by his bike. In our region, it's worse because women lose up to 25 years of their lives if you take the plane and cross the borders from one country to one country. Can we do something about it? The good news is yes, but we need to put our hands together and to embrace a new approach to address all these complicated challenges. Women's health requires intra-sectoral, which is health, and multi-sectoral approach, which is beyond health. We see on the screen here, and these bubbles are not exhaustive of those issues that women in the region are experiencing. It includes some health problems, some contextual factors, but this makes the issue of looking at women's health in a comprehensive way very challenging, because we have lifestyle issues that include smoking and obesity and exercise. We have aging. We are not giving much attention to older women in our lives in the region. We have climate change, and climate change is a very special story, because last year, I don't know if colleagues on the call in the audience are familiar with this, but last year the region hosted the COP, the Conference of Parties for Climate Change, which is the largest United Nations gathering of governments addressing climate change. It was hosted in Egypt last year, and luckily this year it's going to be hosted in Emirates. So these two very big global events on climate change include a key component on how health is affected and affects also climate change. So we are having this sort of momentum in the region by having the COP last year in Egypt and this year, inshallah, in Emirates. So we need to benefit from this momentum that it's creating in the region to attend to the health problems that accompany climate change. We have breast and cervical cancer as key issues that we are also discussing today, the issue of cervical cancer. We have maternal health issues. We have poverty. That is a very compounding factor to health, because we are realizing more and more for several decades back that health is not only about the provision of medicines, but it has other dimensions or social determinants, as we call it, which include poverty, education, empowerment, gender-related issues. So it is a complicated issue that we need to take all of these into consideration and attempt to address them. We have mental health problems that are very prevalent in the region, but unfortunately, it's not giving the attention that it deserves. And to make things worse and more complicated, the blue bubble at the bottom, which is about the humanitarian and emergency situation, which are unfortunately very prevalent in our region. We have some of the extreme humanitarian and emergency situation in the region. We have floods, we have earthquakes, we have wars, we have internal displacements. And who suffers the most when we have these tragic incidents? It's women who suffer the most and their children. But what are the factors that influence women's health that we need to work on and embrace a comprehensive, holistic approach to addressing them? This slide will also make it more complicated. As you see now on the screen, because several sets of factors that affect women's health. Starting from the top, social determinants of health, which became very popular with the establishment of WHO's Global Committee on Social Determinants of Health several years back. These include women's status, discrimination, education, and other things that we're all aware of that influence women's health and access to quality healthcare services. We have commercial determinants as well, which include some unhealthy, profitable practices and products, including smoking, for example. We have health system determinants that is very much related to what we are discussing today, because our natural counterpart in the World Health Organization are the ministers of health and the ministries of health worldwide. However, we are realizing more and more for several years now that health is a social problem. It's not a medical problem. Reducing health to being a medical problem will not solve the health problems that the world is facing and that the region is facing. So we had to put all these into perspective, agree on the contributing factors, and develop and introduce programs that will address them in a comprehensive way. We have individual behavior determinants as well that influence women's health, physical environmental determinants, which very much relate to environmental pollution and climate change, which are beyond our control, but There are several interventions that we can implement and advocate for. So governments will try to reduce the pollution, to address climatic change impacts on health of the whole population and on women in particular, because it has a higher impact on women's health. And last but not least, the economic determinants, access to jobs and resources, and to empowering jobs. This is also a very critical factor that more and more are realizing it's a key contributor to women's health in the region. So we are advocating for adopting what we are calling a women's health lens. Why is that? Because by adopting this women's health lens, we'll look at women's health problems a bit differently. First, we have the very clear health issues that are women-specific, such as cervical cancer and breast cancer. And here I underline the breast cancer because it's not only a women's health problem, it's also a man's health problem, because men also get breast cancer, and it is a rare incident, yes, but if it happens, it's very aggressive, more than what happens in women. So it's more deadly if it happens to men. And this also provides us with an opportunity to bring men to the discussion and to bring them on board so they understand that breast cancer is not a women issue only, but it also affects you and can happen to you. So let's put our hands together, men and women, to address this issue in an effective way. Another issue that having this lens of women's health will help us do is to address the issues that are more prevalent among women. So we look at all indicators from this perspective, that we have to have that sort of gender breakdown or sex breakdown, men and women. Then we go into deeper analysis and see why and how these issues are more prevalent in women. And a good example of that is depression, because in the region and beyond the region, it's more prevalent among women. Why is that? What can be done? It's beyond the health sector. Yes, health sector can lead, but it's not the sole responsibility of the health sector. Another issue that unfortunately our region is experiencing also, issues are on the rise among women. And now we have smoking. And I'm sure several of us have witnessed this because it's increasing, especially among young women. Smoking of shisha, of cigarettes is very much becoming more and more common in the region. We see it around us everywhere. Other issues that require equal attention among women and men, but, and this is why I had these next two words in bold, because they present differently. This is also another unfortunate issue, but it's starting to be fixed worldwide, because several or most of the research on medicines and medical interventions are done only on men. That's why women's reaction, their body's reaction and acceptance of medicines is something new that we are exploring more and more as we go on. Several years back, pharmaceutical companies and manufacturers of medical devices and equipment realized this and are becoming more and more inclusive of women. Imagine that a couple of decades back, or maybe 3 decades back, all the samples that were testing any drug or new technology, or even seat belts for cars, for example, were tested only on men passengers. I don't know, maybe assuming that women will never get on a car, I don't know. But this was the case. Then car manufacturers realized that, no, we need to be attentive to this issue because women drive cars, women are passengers in cars, in buses, in all means of transport. So we have to look at this issue. Another problem, vulnerable groups. And again, our region unfortunately has so many of these. And these include women with HIV/AIDS, for example, women with disability, and older women. Are we attending to their needs? Let's take an example of women with disability. Blind women. Can they go to our health facilities? Are these facilities accessible? Women on wheelchairs. Do we have ramps in all the health facilities? Deaf women. Do we have anyone in the health facilities or in hospital or in any setting that can at least have the basics of sign language and communicate with those women about their health needs? So these women are denied their basic health needs for a very simple factor. Maybe we can train some of the nurses or midwives in the facilities. We do not have to create a new cadre with cost implications and bring experts in sign language. So providing some sort of basic training on sign language for certain health workers in facilities or those who are doing community outreach will help access those women and address their basic right to health. Social determinants, again, another issue that I already briefed about earlier. And last but not least, the contextual issues. And primarily here, we are concerned with emergencies and humanitarian situations, and added to them now the climate change. Because evidence and analysis shows that women tend to be more affected with their children in these situations, because men can go to war, do other things, they can move, but women are not easy to move as men. So it ends with them suffering more in the end out of these situations. So what we are seeing here that women's health are multifaceted. It's not a medical problem. It's not an issue that only the Minister of Health should and could address. It requires that the machinery as a whole of the government, civil society, international organizations, women's health advocates, media, name it. All partners should have their hands together to have an integrated approach. So we can together address this. And I'm really happy because today, this discussion, we have several of those sectors on board with us. We have academia on the call, we have UN organizations, we have the civil society, we have FOCP, Friends of Cancer Patients, we have private sector. So this is an example of how all of those entities and partners from different sectors are getting together to speak about cervical cancer as we are trying to address it today. Women's health then are very much linked to quality healthcare, poverty, the health system's fragility, power relations in the society and within the family, years spent in education, employment, access to resources, environmental risks. And this is not an exhaustive list, but these are examples of key issues and opportunities also that could help us address women's health needs. We have a couple of opportunities that we need really to capitalize on. The first one is that in 2016, the United Nations launched the Global Strategy for Women's Health, Women, Children, and Adolescent Health that takes us until 2030, where the SDGs are supposed to end. We called it Survive, Thrive, and Transform. And this strategy provides us with a framework and provides government and civil society and everybody who's interested into the health sector with a framework on how to address these issues. Not only a global one, because we may say, okay, but our region is very different, but also another thing that we have الخطة الاستراتيجية العربية متعددة القطاعات لصحة الأمهات والأطفال والمراهقات. The Arab region's strategic multi-sectoral plan for mothers, children, and adolescent girls' health that was led by the League of Arab States and also UNFPA was a leading partner with this, with inputs from different organizations. So we have a global framework, we have a regional framework, and both of them, we hope that also at the country level, ministries of health and the different health partners can adopt this, what we are calling a healthy adult life cycle approach that looks at the woman starting from late adolescence into being a young adult, older adult, and an older woman. What are the health needs of these different life cycle stages, and how best can we address those needs in a comprehensive manner and not single out, for example, when we say that women at reproductive age, we look only at the reproductive part of the woman and their contribution to the humanity by getting pregnant, delivering babies, and helping with raising them. So we are in a sort of being unfair and reducing women's contribution to their reproductive lives, where in reality, they have much more, a much broader contribution to the society as a whole, to the well-being of humanity. Then what? What can we do? Linking this issue to cervical cancer, the issue that is under the lens today, we have the global cervical cancer elimination strategy. Now we have the regional cervical cancer elimination strategy, and this provides us with the momentum that we can then advocate for these, mobilize resources, use this opportunity to partner with governments to highlight the importance of working on and addressing cervical cancer, especially that now we realize that it's largely preventable. with the HPV vaccines, we realize now that it is largely preventable, and we also advocate for screening if we miss the opportunity for vaccination when we're young. So we get older, we advocate for screening. If screening is not an option, then we advocate for appropriate treatment and palliative care for those unfortunate women who may get the disease. What do we need to do as well? We need to invest more into partnerships and joint advocacy. Like our event today, this is a very evident example of partnerships and joint advocacy. And I hope that after the conference, we'll have also those joint advocacy events. So several of the colleagues on the call and the organizers will be speaking to media and to several outlets on the importance of cervical cancer and how this partnership will help bring together those different partners and also create this momentum of advocacy and hopefully implementing more and more programs on cervical cancer. Other opportunities exist very much on the cross-cutting programming. Those that are very evident: sexual and reproductive health, non-communicable diseases, maternal and child health programs, gender-related programs. And these provide us with a golden opportunity, really, because if I'm having a program on maternal and child health, why don't I include also a component on women's cancers? Cervical cancer is very much related to the reproductive period of women's lives. So we can use these opportunities to have integrated and cross-cutting programming so we can all talk the same language and use the opportunity of a woman coming to the health facility, for example, to vaccinate her child. We use this opportunity to tell her about the HPV vaccine, about the screening, about options for treatment if she unfortunately got the disease. So we have several opportunities, but we need to be open to these opportunities and be flexible and try to think through this women's health lens that I'm talking about. Another important issue that in the region we are not giving much attention to is to try and spot those what you call promising practices. How the different countries are dealing with cervical cancer and women's cancers in general. We look at any positive experience and we try to promote it, identify whatever lessons we can learn from it. We look at the civil society, what are they doing, academia, what is their contribution with research, with the creation and availing of evidence that will help inform policies. So we need to have this sort of flexible eye looking at those opportunities so we can advance these efforts. What can we do next? Build on ongoing efforts. Whenever we found an ongoing effort that addresses cervical cancer, let's put our hands in. Talking in a more general way about women's cancers, yes, let's be there. Talking about primary health care in a more general way, it's a great opportunity that we integrate our priority areas and our messages on cervical cancer into these. So we need to be really flexible and see whatever ongoing effort that is successful, we need to use this as an opportunity and to partner with whoever is implementing this program. Joint prioritization and technical support at the regional and country level. Again, looking at those opportunities and together with the governments and ministries of health and all other health-related partners, we agree together on the joint priorities. And also what's special about cervical cancer is the preventability of cervical cancer. This is a golden opportunity, and I believe it's the first time in human history that we have a cancer that is largely preventable. So this is an opportunity that we have to embrace. And if we do not have the resources to embrace it and to purchase the vaccines for economic and financial reasons, at least let's invest in the advocacy part. Advocacy, yes, it can cost money, but at least in our circles, we can contribute to this advocacy by spreading those correct messages to the people around us, to our friends, to our neighbors. So we use this opportunity, at least at the individual level, to contribute to increasing the awareness and the prioritization on cervical cancer. We need to be open to all opportunities and mainstream women's health in stable as well as fragile and humanitarian settings. And our region, as I was explaining earlier, is unfortunately blessed with lots of those humanitarian settings, whether it's man-made or natural disasters, but we have millions of people who are refugees or internally displaced people are on the move, crossing borders at different times. So we need to be aware and alerted to their health needs, because those women have no one, unless they were addressed by any intervention program that looks at their needs, whether from civil society or from the United Nations or an international development partner. So we need to be alerted to the needs of those women in such situations. It's an integrated approach that we need to adopt. It's a comprehensive look to women's health, and cervical cancer is one of the key problems that women face in the region and beyond, and it is largely preventable. We need to do it together. Thank you very much. I hope I did not exceed my allocated time, and appreciate the support of the organizers and the sponsors for this very important thing. Thank you.
Thank you very much, Dr. Afifi, for your comprehensive talk. And now let me introduce Dr. Lamia Mahmoud. Dr. Lamia Mahmoud is a public health professional with a medical background and more than 25 years of experience in the field. She has worked in the public health sector in Sudan in various positions under the primary healthcare umbrella. Dr. Mahmoud joined the World WHO in 2012, and she also contributes more than 20 years of experience in national and international development in public health across various programs and covering both prevention and curative perspectives. Her work experience extends to encompass NCDs, maternal and child health, health promotion, nutrition, and health system development. Since joining WHO Regional Office, she has been driving the cervical cancer initiative at regional level. Dr. Lamia will give us a talk about update on regional cervical cancer elimination strategy. Dr. Lamia, welcome, and the floor is yours.
Thank you. Assalamu alaikum. Good afternoon, everyone, and very happy to be here with you all and to be sharing with you our regional cervical cancer elimination strategy. Thank you once again for this opportunity. Thanking FOCP, thanking the organizers, conveners for all the support that enabled me to be here today with this great audience that I can see, big numbers, that I'm very happy I'm getting the opportunity to share with you our regional cervical cancer elimination strategy. And I thank also Dr. Afifi. You really set the ground nicely for me in terms of bringing that woman's lens perspective, highlighting the need to advocate and support such vulnerable groups and the linkages it has with cervical cancer elimination. So I'm Lamia, and I'm wearing teal today. I hope you're also wearing teal to commemorate this event today and this important month for awareness raising on cervical cancer. And I will be speaking within the next 20 minutes. I hope I don't go over time on this regional cervical cancer elimination strategy. So I just wanting to share that in 20, I'm not sure, do you see this panel that I have, or is it? Wait. Apologies, technology always fails me. So
yes, we can see your slide.
Yes, but they've gone too fast. I just wanted to go back to the previous slide, and it's not helping me. So I just wanted to share that in 2020, WHO website featured the year 2020 as a year of elimination. And at that time, the call was basically focusing on elimination of communicable diseases. But it was also an important year for us when it comes to NCDs, because we know that cervical cancer is it's a cancer that can be communicated, and therefore the launch of the global cervical cancer elimination strategy within 2020 also serves as a significant milestone for us. So in this brief talk, I will be sharing with you how we have developed the regional cervical cancer elimination strategy through a very comprehensive and inclusive process, telling you what the regional strategy is saying, and then discussing how do we go from here, building on the opportunity of having so many partners today with us in this important event. So this busy slide it aims to show you again how comprehensive and inclusive the process was. So taking it from the launch of the global strategy that took place in November 2020, and given the current situation at that time of COVID, throughout 2021, we realized there was not much uptake within the region in terms of implementing this global strategy. And therefore, to being WHO and being evidence-based, we really wanted to conduct a survey at the regional level to look at what are the bottlenecks, what would encourage countries to uptake, and why is it not happening. So in the first part of 2022, we conducted a regional cervical cancer survey. It was preceded by a stakeholder engagement plan, a look at the, a desk review, looking at what's available in the region. And through the survey, we interacted with 20 of the 22 member states in our region to really look at the bottlenecks and issues, to look at what's there on the ground, how far they are on implementing the different components of the global strategy, and what do they perceive in terms of capacities and feasibility of reaching those set targets. Once the strategy was drafted, we conducted a regional consultation on this draft regional strategy from 7th to 9th of June last year. Very valuable inputs were generated through that regional consultation that we did. We used that to further support or formulate the strategy, and then we put up the strategy for an online consultation in the last part of August to the first week of September, in which we encouraged all partners, because we really wanted to see more engagement, not only from member states, but also from civil society, from people with lived experience, from all the different actors and partners who are working on this important health issue. We managed to finalize the draft strategy by September, and we presented the strategy in the pre-RC meeting of our regional committee, the 69th regional committee that took place in October 22. I must say that there was very good response and support from member states to the strategy that was proposed. We also got inputs from member states in terms of how they're also looking at it, what's in place, what the plans are. And then just earlier this month, on the 11th of January, we did launch this regional strategy through a press conference, which was well attended, and I will speak to that later. And this, has put us, has positioned us in a very nice way to look at what are the next steps in terms of supporting country implementation. And this is what we envision working together with the different partners and stakeholders. So I just want to take you a bit of an in-depth or a deep dive into the regional cervical cancer survey that I spoke about that took place in 2022. And we used the opportunity to look, as I mentioned, into the 3 streams of work that are proposed in the global strategy. So in terms of HPV vaccination availability, at the time of the survey, 3 countries had reported that they had an HPV vaccination program. At that time, we had these were Libya, and we know that this started way back, had a few challenges moving forward, but still considered to be one of the early implementers, UAE and Saudi Arabia. We also had 8 countries, but I just want to emphasize here also, I don't want to forget that since then we have had a lot of interest from other countries. Some are actually implementing, like Morocco have started implementation during 2022. And then there's interest from Kuwait, from Tunisia, and there are others who have expressed their interest, but these are the ones, for example, who we know have been moving solidly. So these countries are part of the 8 that were planning to implement the HPV vaccination program, but 8 countries articulated very frankly that they had no current plans to implement HPV vaccination, and this was based on the competing interests that they had at country level. So just again, a deeper look at the perceived barriers for HPV vaccination. Stigma around HPV and safety concerns were the biggest concern that was articulated by member states. And of course, the cost of the program was articulated mainly by middle and low income countries. I also want to emphasize in this big list, the issue that was mentioned by some countries is the lack of political will. If one, it's only around 20%, but it's still a significant component because we do need to have the political will in place, not only to initiate the programs, but to sustain them. And then in the survey, we also asked countries whether they considered it was possible to achieve the 90% HPV vaccination coverage in 15-year-olds, and the responses was mostly possibly. So that was very reassuring in a sense that countries are not blocking this. Even those who do not have an intention to start now consider that this would be still a possibility. Now, when it comes to HPV screening, the survey reported that there's only one member state at that time who had an organized HPV national screening program, and that was UAE. But 3 member states reported that they were planning to upgrade or alter their existing screening program to also include HPV testing alongside other methods of screening. 4 member states were looking at adopting a new HPV screening program, and 8 member states were undecisive at that point, not yet decided whether to implement, and 2 very frankly said that this was not their priority at the current time. And in these countries that were not ready for this, the lack of financial and technical resources was the main barrier that prevented them. So detailing these barriers, as mentioned, the lack of screening infrastructure, the cost of HPV tests were key issues cited by 2/3 of member states in the region. And then again, the issue of awareness and lack of understanding. Women do not really need or perceive the need to do screening. That's how they see it. And therefore, this is an area that really needs a lot of awareness raising and advocacy. Again, I've highlighted one barrier that was mentioned is that the countries seem to believe that there is an insufficient burden of the disease to justify screening, which might not be the case because we really have to acknowledge that the data that we have might not reflect the current situation. Data is very much based on modeling and estimates, and therefore we need real data from countries locally generated that would really set the stage, allow us to know where we are, what needs to be implemented. And we are happy to see that many countries in the region are actually moving ahead with generating such local data to know the types of prevalent, which types of HPV are prevalent here, and also know their actual burden. And then when it comes to treatment, as you can see, both in the public and private sector, radiotherapy and palliative care were the most critical gaps. And these are areas, if we want to ensure that women can access services that they need without significant hardship, then we really need to ensure that the full package of care is available to all women, and so that we reduce treatment abandonment in these vulnerable groups. So then this, moving on to, from this survey, we have produced the regional cervical cancer elimination strategy for the Eastern Mediterranean, which is very much aligned to the global strategy in terms of the goal that the global strategy aims to achieve, and that is achieving an incidence of less than 4 per 100,000 women, and also in terms of the 90-70-90 targets. So just to dip into the regional strategy, as I mentioned, it aligns with the global strategy, but using the survey findings, it has been contextualized to the regional level. And therefore, as you see, although actions 1 and 2 and 3 are very much aligned with the global strategy and what it calls for, we have added 2 enablers that are very specific and relevant for our region. So recognizing the health system gaps and needs, we have added an action that addresses health system strengthening, and looking at the issues of stigma and lack of awareness that were raised during the survey, we have tried to emphasize this further, this component, through action 5, which focuses on communication advocacy, as well as social mobilization, because we really need communities and people with lived experience to be part of the efforts and fully engaged. So in these slides, the coming few slides, I hope I don't bore you, but I just want to dip a bit into each of these 5 actions. They're very busy slides. I will not read them, but I just want you to know that the strategy is very detailed in terms of emphasizing or explaining how each of these actions can be achieved. So in terms of strengthening the primary prevention through vaccination, there's a lot of focus on service delivery through different platforms, through different structures, and a focus on using the school-based and community-based programs. So we've seen, for example, in Saudi Arabia, they have managed to achieve great coverage since they started in 2022. I think they reported in December more than 130,000 schoolgirls being vaccinated through the school health platform. And therefore, we would encourage adoption of such approaches that facilitate the reach to our target audience. In terms of health workforce, we need to ensure that we have our health workers have the right knowledge to advise, to administer, and so on, but also to have them proactively engaged in the initiative and owning the initiative. Health information systems are critical when it comes to HPV vaccination in terms of ensuring that when we're moving towards set targets in a solid manner, knowing our gaps, and as well as reporting against adverse outcomes. And then, of course, financing is a key pillar when it comes to providing such services. And we really need to tap on the resources that are available. In our region, 7 countries are Gavi eligible. And therefore, it would be very supportive to the implementation at country level if countries could tap those resources, generate the data needed to validate why they would like to include HPV vaccination within the Gavi support, and then move solidly with implementation. Furthermore, the recent SAGE recommendation, which I'm sure my colleague Kamal will focus on, is really encouraging in terms of the one-dose recommendation, which will definitely reduce costs and enable greater reach. Moving on to the second action for screening and pre-cancer treatment, again, the detailed actions for service delivery address all the different components using what the learning from COVID and the infrastructure created by COVID to support laboratory infrastructures, integrating into other women's health services. We're now looking at, in many countries, considering to look at women cancers, so that you're looking at a broader package. And then the opportunity of self-sampling, which has been shown to be more acceptable to many women. In terms of the health workforce, we need to build workforce capacity, but at the same time, build on what we already have. So countries that have other modalities for screening in place, we need to optimize on those modalities until we are able to put HPV testing in place. And then, of course, health information systems that will help us ensure that we are reaching the most vulnerable women. We are leaving no one behind. And then the governance and financing, which can be supported by emerging technology. Again, the infrastructure, as mentioned, that has been provided for COVID. And then there are efforts by WHO and partners in terms of reducing pricing costs and working on the different marketing strategies. Action 3, relating to treatment, again focuses on service delivery, ensuring that all the package of services that would be needed are in place, both for precancerous lesions as well as invasive cancers, as well as palliative care. The need for multidisciplinary tumor boards, ensuring that the health workforce capacity can address the different modalities of treatment, be it radiological, surgical, medications, and the palliative care capacity, information systems that allow us to monitor our progress, and of course, ensuring access. And there's major effort in this region to support local production, which will definitely benefit the overall region. And then, of course, having cervical cancer part and parcel of our overall cancer planning, of our overall health services and universal health coverage benefit packages. The two enablers that I have mentioned, again, put more emphasis on those critical aspects of health systems, ensuring that these components of cervical cancer support are included in national insurance schemes, that the health workforce is able to deliver within the different settings. Information systems accommodate cervical cancer as part of its routine reporting, access to medicines through all different public and private sectors, and then that the governance and financing is in place, and this can be supported through modeling, through investment cases that can highlight the returns on investing in cervical cancer. And last but not least, and indeed the most important, is around communication advocacy. We need to get the message out there to counteract vaccine hesitancy, and learning from COVID also respond to vaccine misinformation. We need to engage everyone. Everyone has a role to play, and we know and acknowledge that civil society and NGOs are closer to communities, their voices are heard more, and they listen more to communities, and they are a key partner in the implementation. We need the healthcare workers to really be non-judgmental in dealing with patients, so as to encourage patients to come forward. Our advocacy needs to address all levels and all the right people and our stakeholders. And then, of course, addressing the health literacy, ensuring that all the information that the public needs to know is out there, accessible, and within their reach, using the different channels. And this, of course, campaigns would play a critical role in making sure that we reach target communities. So we launched the strategy, as mentioned, on the 11th, and we had very good coverage for that. These are just a few samples of the media coverage. And even yesterday, I was looking at spotlight from the media in WHO, and it was very heartening to see that still the media is covering a lot of what we did. 27 news outlets reported on cervical cancer during that week. There was very striking messages on the headlines, telling the public that this is a cancer that we can eliminate, and it's time to do that now. Emphasizing how much delayed we are as a region in implementing the global strategy, that we now have a regional strategy that we should move on. And of course, because this was happening in Egypt, of course, in our regional office, the coverage was mostly by local media. But I just want to share also that just 1 week ago, our regional director had an interview on Al Jazeera, where he spoke very strongly and passionately about the need to address cervical cancer. I have the link there on this presentation, so if the presentation will be shared, I'd very much welcome you checking out this short video on Al Jazeera. So this takes me to my last slide. The next steps, as mentioned, we now need to move strongly with implementation. We look for strong engagement from all partners, all stakeholders. Member states need to be in the driving seat and leading the way. We look forward to having a strong engagement from all the different partners, civil society, people with lived experience, and academia. Everyone has a role to play, and we'd be very happy to accommodate and work and engage. WHO and partners have put in all the required technical support that would enable us to move forward solidly with eliminating cervical cancer. Resource mobilization, nothing happens without money. We know that and acknowledge that, and we have to be realistic. So we really need to leverage and on existing funding opportunities, but also be innovative in pursuing new modalities of funding, and also, of course, use new and emerging technologies that would facilitate all the different streams of work that we have spoken about, be it for treatment, be it for testing, and of course the new recommendations when it comes to vaccination. So I hope with this I have given you an insight into what the strategy is saying, but also encouraged the partnership that is needed to move this strategy forward. So thank you for your attention, and thank you once again to FOCP for giving us this opportunity.
Thank you, Dr. Lamia, for your comprehensive talk. And now we will move to our panel discussion covering the topic of emerging innovations to support elimination of cancer, of cervical cancer. This panel discussion will be moderated by Dr. Nassim Pourghasyan. Dr. Nassim is a medical doctor with experience in clinical and public health in Europe, Middle East, Bangladesh, and Afghanistan. She obtained her medical degree in Sweden and joined WHO in 2017. Prior to joining WHO, she has worked with a number of NGOs such as BRAC, Swedish Committee for Afghanistan, Amnesty, and Médecins du Monde. In her previous position as a technical officer in the Department of NCDs and Mental Health, she provided technical support in the field of NCD prevention and management to ministries of health and other key stakeholders, and was coordinating the regional rollout of the WHO childhood and cervical cancer flagship initiatives among other things. She is currently Technical Officer in the Office of Director of Program Management in WHO EMRO, and her aspiration is to continue working with public health in a way that engage stakeholders and individuals beyond the health sector to improve the health and well-being of populations in an equitable way. Thank you, Dr. Nassim. The floor is yours, and thank you for moderating this panel discussion.
Thank you very much, Micheline, and welcome to all. Greetings to everyone. Thanks for having me here in the Third Cervical Cancer Forum, and welcome also to our esteemed panelists for today's discussion on emerging innovations to eliminate cervical cancer. Thank you also to Lamia. I think she set the scene very nicely with the regional cervical cancer strategy. We have the strategies, we have the normative guidance, we have the evidence and the knowledge on how to eliminate cervical cancer. But in order to really reach implementation in our diverse settings, we need to leverage on different innovations, both in terms of technology, but also innovative approaches on how to make the interventions across the three streams of vaccination, screening, and treatment accessible to all. I would like to start by introducing our first panelist, Dr. Kamal Fahmy. Welcome. Dr. Kamal Fahmy is Medical Officer in the Vaccine, Preventable Diseases and Immunization Unit at WHO, Regional Officer in Cairo. He received his medical degree from University of Alexandria in 1992 and completed his postdoctorate research in public health and occupational health at Hôpital Cochin, Université Reine Descartes in Paris in 2004. He has extensive experience at WHO since he joined in 2000, and he has received the Category 1 of the Physicians Recognition Award of the American Medical Association, and is a member of several associations in both Egypt and France. Welcome, Dr. Kamal. I'll start with you, and then we'll proceed and introduce the other panelists one by one. Dr. Kamal, as you work with HPV vaccination, and we've heard a bit about the countries of our region that have introduced it, others that are considering, and some that are hesitant. My question to you is that recently there has been some emerging evidence that one dose HPV vaccine regimen has comparable efficiency and duration of protection when comparing with the previous two-dose regimen. Can you tell us a bit more about this recent SAGE recommendation and why it's an important step in our vaccination efforts? Over to you.
Thank you very much, Dr. Nassim, for this introduction. Actually, I'm very happy to join this very prestigious panel discussion on cancer cervix elimination and specifically on HPV introduction. Actually, until the last year, the scheme for introduction of HPV was to give 2 doses to all girls from 9 to 14 years old and 3 doses above 14 years old until 26, as well as for the immunocompromised and HIV women. However, with a very big number of research happening in many countries of the world, WHO have been able to compile all these analyses and found that the vaccine effectiveness of 1 dose is equally effective as 2 doses. That's why, with a lot of research and analysis, the SAGE recommendations came out in the WHO position paper, the newly one published in December last year, after the first one, which has been published in 2017, mentioning that one dose of HPV is equally effective as giving the 2 doses or 3 doses to the children. However, a second dose would be added to a specific category of women, which are girls older than 15 years until 26, as well as the immunocompromised. So with this new recommendation from SAGE, it is considered as a game changer because of many aspects of obstacle challenges for this vaccine introduction. Number one, the supply will be much better. Maybe we'll be discussing it at a later stage. However, the most important thing that for countries seeing some challenge and obstacle at the community level for introducing this vaccine, this one dose vaccine will be very much encouraging those countries to start implementing the program in the routine immunization program, introducing this vaccine, and also engaging the community and accepting this one dose vaccine. One of the most important factors that this one dose will be a game changer in the whole HPV introduction, not only in our region, but in the whole world, is that the cost. This vaccine is an expensive vaccine. However, it is given as a subsidized price to a number of countries, whether low-income countries or middle-income countries. However, when it will come to one dose, it will significantly reduce the cost of affording this vaccine, and thus it will encourage more countries to introduce it in the near future. Over to you, Dr. Naseem.
Thank you very much. So it will improve supply, it will reduce the loss to follow-up, and it's a cost reduction that is significant for our countries. You mentioned the supply. A few years ago, many people's concern was the supply of HPV vaccination. Can you say something about the market today since new manufacturers have entered?
Yes, actually, supply was one and the most important and principal challenges for the country to introduce this vaccine until late 2021, starting 2022. However, during the COVID pandemic in the last 2 years, there was a kind of a low demand from the countries, which has increased the stock of the vaccine everywhere in the globe, as well as in addition of more manufacturers coming, which would be in many countries of the world, and a large number of manufacturers will join the market to produce more supply. And at the last, with the new recommendation of SAGE having one dose of HPV vaccine, I think that there will be no shortage of supplying any number of vaccine to any country when starting demand will be taken care again during this year. So supply is no more an issue, is no more a challenge, no more barrier for any country to for procurement of their vaccine as per their population. In our region, there are very big countries with over 200 million population. There are very small countries with less than 1 million population. So there will be equally access to any kind of vaccine, any type of vaccine, any number of doses, being the supply no more an obstacle for any country to consider it during their planning for HPV introduction.
Thank you very much for that. I would now like to introduce our second panelist, Dr. Iman Al-Tawhid. She's a consultant gynecologist at the Kuwait Cancer Center since 2013. She's also the General Secretary of Kuwait Oncology Association since last year. Apologies. She specializes in obstetrics and gynecology, and she has extensive experience working in multiple hospitals in Ireland, UK, Saudi Arabia, and Kuwait. She is also a representative of the Society of Laparoscopic and Robotic Surgeons in the European Surgical Academy. Welcome, Dr. Iman.
Thank you very much, Dr.
And I would like to ask you some questions pertaining to the second stream of work, that is screening. Although, as you know, and Lamia mentioned on the regional strategy also, HPV testing is recommended. And although it's more expensive than previous screening methods, it does allow a much longer screening interval, which would be more cost effective in the long run in all of the settings where we want to implement it. Could you tell us a bit about other innovative aspects related to HPV testing, such as self-collection, and what possibilities there are related to this?
Yeah, okay. Thank you. First, Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Nassim, and I would like to thank the organizing committee for getting me involved in this very important forum. Now, I just want to give a brief introduction about what's happening in Kuwait, because when you Google the cancer cervix in Kuwait, you found very, very little data. And the reason behind this, that the incidence rate of cancer cervix in Kuwait is ranging from 3 to 4 per 100,000 women among Kuwaiti women ever since when we started the registry, the cancer registry, since 20 years ago. So the incidence did not change since the last 20 years, despite the change in the socio-economic, of course, and the culture and the things in Kuwait rapidly changing now, with being the world is a small village, of course. Now, this is the way, when I looked into the data, I thought maybe there is something with the data, whether it's not precise or why people are not getting screened, because the uptake of the screening of the cervical cytology screening here in Kuwait ranges always between 15 to 20%. So the uptake is quite small. So when since I started, of course, practicing this, when I joined the KCC since 15 years ago, I tried to question the ladies, what makes them not getting their cervical smear. Now, many of them, because basically of vagina examination. You know, women, they don't like having, you know, it is normal for the child, but they give, they have babies, you know, they deliver normally. But when it comes to having a speaker examination and vagina examination, it is very inconvenient for them. It is makes them, you know, under stress. And so that's, I thought we might have, we can have an idea to have something different, which is urine testing, for example. Because the urine, it is cheap and it's easy collected, and they can do it at home. So it is very well accepted by many of them. So this is my now next project. Now I'm starting to advise women. Obviously, we need a special like device that to be delivered to them, or they can collect it from the polyclinics scattered here in Kuwait, and then they can provide the sample, the urine sample. Obviously, it will be the first voided urine sample, and then we can send it to the lab so they can check the high-risk HPV virus, the titer in it. Obviously, we have sophisticated labs and we have all the facilities, because maybe many people know that Kuwait is a relatively rich country and we don't have problem with the economy in that sense. So I thought if we can develop a special device in collecting this urine and deliver it to the very special central lab in Kuwait, and then we can assess the HPV titer in these samples, and then we go from there, so we can have relatively more accurate figure about the size of the problem in Kuwait. Over to you, Dr. Nassim.
Thank you very much. And as urine sampling in itself is an emerging field of testing, do you also use vaginal swabs for HPV testing in your practice?
Actually, now everybody's still sticking to the traditional cervical cytology, you know, the thin prep or the cervical smear. But I'm starting now doing the vaginas. The problem is the size of the size of the material you have. You know, many people, many women, they don't like to come obviously to the cancer center. They prefer to go to the polyclinic, and the polyclinic are very much scattered, and it is difficult to get one lab for all the polyclinic. We have mainly 4 to 5 central labs all over Kuwait. So now we're trying to spread the idea is to have a vaginal swab, because it is with the vaginal swab, you don't need to put speculum in, which is the main discomfort for the ladies. So you don't have to put space. So now vaginal swab, perhaps it will be the next step for the gynecologist to start with now.
Thank you. So my understanding is the acceptability is well among the patients. How about the health workers?
Well, I think we don't have problem with the health workers, because they do suffer like I do in convincing the patient.
Eases their work.
in convincing the women to come over to have their smear done, you know. So this is because with the vaginal swab, many women they complain of discharge or whatever gynae problem it is. They even the nurse that can take the vaginal swab, not necessarily the gynecologist. So it will be very convenient for them as well to be exposed to different, not necessarily the doctors who are, many of them that are quite busy in their practice. So it will be, we can get the nurses involved in having, doing the vaginal swabs for the woman. Yes, over to you, Dr. Anasim.
Thank you. Thank you very much. I would like us to move to our third panelist, Professor Humaid Al-Shamsi. Welcome. Can you hear us? Yes.
Yes,
so
I can.
Professor Humaid Al-Shamsi. Welcome. Professor Humaid Al-Shamsi is an American and Canadian board certified in medical oncology. He completed his medical degree in honors from the University College Cork in Ireland, and he completed his internal medicine residency and oncology fellowship at McMaster University in Canada. He's currently a consultant of oncology and director of Burjeel Cancer Institute in Abu Dhabi and holds a professor position at Sharjah University. He is also the president of Emirates Oncology Society. Professor Al-Shamsi has extensive clinical and research experience in solid malignancies, and he's a strong advocate for palliative care in UAE, which I'm very happy to hear. I would like to benefit from your clinical experience, Professor Humaid, and hear a bit about, based on your clinical experience, in what stage do cervical cancer patients usually present in your practice or the settings that you've worked in before? Over to you.
First of all, thank you so much, Dr. Nasim, and I would like to thank the organizing committee for bringing this very, very important topic, which is cervical cancer, and the topic of vaccination, HPV vaccination, which is a topic that we didn't talk about much in the media because of the cultural barriers, as Dr. Iman mentioned just a few minutes ago. So regarding the stage of the presentation, as a medical oncologist, I tend to see patients who are actually advanced stages, who are not eligible for the simple procedure to remove the pap test or colposcopy. We usually tend to see these patients when they have advanced cancer that requires either consultation prior to surgery, consultation for chemoradiation, or even consultation for palliative chemotherapy. Because again, the presentation could vary. I tend to see patients who are locally advanced more in my practice. And again, I think it's usually patients are not able to recognize their symptoms. They are postponing, getting to see the gynecologist for any reason, especially elderly females. They tend always to find an excuse. I'm bleeding because I have a problem, something else. But the thinking about cancer is not quite there. And when they usually go to see the doctor, usually it is actually at least locally advanced. I can't remember the last time we did surgery for a patient with cervical cancer. We usually do chemotherapy, which is always remind me it's a locally advanced. It's beyond surgical intervention because of the extent of the disease. So usually it's locally advanced, or unfortunately advanced, spread to the liver or lung, where we have to treat this patient with palliative intent.
Thank you very much for that overview. And you mentioned some of the barriers or the factors of delay to treatment or to seek treatment. Could you give example of any innovative approaches that could help mitigate these kind of barriers or loss to follow up among women with cancer?
Well, actually, we did the largest study about cancer awareness in UAE. It has not been published yet, but actually we're writing the manuscript now. We surveyed more than 2,000 adults in the UAE, and guess how many people recognize that cervical cancer screening is starting at the age 25? Give me a number.
I don't even dare.
Easy. Less than 10%. We talk about 2,000 adults. Yeah, only 6% actually. Only 6%. They recognize that the cervical cancer started at that age. And again, I think we need to educate, and that's why I mentioned at the beginning, thank you for bringing this topic, because we need to increase the awareness about cervical cancer. We need to increase the people awareness that, if you have symptoms, you have to see your doctor. If you have pain in your pelvis area, if you have, vaginal bleeding that's not your period, or you have any other symptoms, you cannot just, assume it's something else. So thinking about cancer, we don't want to scare people, but sometimes it is cancer and it tends to be spread. So I do believe that not only cervical cancer, but we know that the cancer rate and the incidence will be increasing over the next 10, 20 years. For example, it's projected in UAE for the cancer to increase by 300% over the next 20 years. And this is not surprising. It already has increased more than 400% over the last 20 years. So we'll be seeing more and more cancer. So the only way to combat this increase is by increasing the awareness about cancer screening. And also we have to increase the awareness about the importance of the HPV vaccine. If we can make it, everyone convinced about the HPV vaccine, it's available in UAE. UAE was the first country in the Middle East to implement the HPV vaccine in 2008. And actually, we're seeing a decline in the carcinoma in situ. We published a paper in 2021, and we showed there's a decline in the cervical in situ in UAE over the last few years. And again, this is just an example how vaccination, there's no question that we do believe it works, but you have to take it so it works.
Yes, exactly. And speaking about the awareness raising, just related to this, Dr. Lamia mentioned the launch of the cervical cancer strategy, and it was surprising to see that some of the headings in the newspapers were WHO presents preventable cancer, but this is not news. This is not a new idea. This is something we have known for years. But as you say, we need to find the right ways to communicate and to target those messages in a way that it has a good uptake. Thank you very much. I'd like to move on to our fourth panelist, Dr. Gertrude Eckert. Thank you for being here with us today. So Dr. Gertrude is a public affairs, communications, patient advocacy, and market access professional with more than 20 years of experience in the healthcare sector in Europe, Middle East, and Africa. She has a successful track record in development and execution of comprehensive public affairs and access strategies, and building strategic external relationships with advocacy groups. So I'm building also related to the question that Professor Humaid just addressed, and I would like to ask you about, except the innovation in terms of medications, which we might get back to later, but it's also about the approaches, as I mentioned, and making the available technology and advances accessible to everyone in an equitable way. Could you, and as we just mentioned, a barrier is, of course, the health literacy and the knowledge. Could you tell us something about or give examples of how increased health literacy and how advocacy work can actually push to improve the health outcomes?
Mm-hmm. Many thanks, and it's great. Let me thank you first to you, the moderator, Dr. Naseem, and the organizers for inviting me to this panel. It's really exciting, and the segue I got already from the speakers on the panel towards the hurdles of accessing innovation in healthcare is certainly in the awareness, in the understanding and programs. We as an industry, and I speak for the broader industry, certainly touch upon this health literacy. What does it mean? It means that there are programs underway where we try to improve the levels of health literacy, of awareness, of understanding. So the one hurdle is the patient not getting the information, or if they get the information, not to be able to really link it to action. The other side of health literacy does touch on healthcare systems. So there are both ways, which should become a bit easier to access for patients and to navigate in terms of getting the prevention, of getting their action down on the ground. We see from global studies that these low levels of health literacy, and I think this percentage of 6% you just mentioned, Professor, was something we saw worldwide, not only in our region, that the levels of health literacy, and not only in the cervical cancer space, but in the broader cancer space, are low. This comes, of course, with big impact, not only on individual, but also on the healthcare systems. They suffer as well in terms of having resources perhaps misused or not effectively used, and where we see that we lose money, which could be used for a sort of more targeted and more helpful ways to get the individual early, either in the prevention or, if necessary, in the treatment and survivorship. I think I stop here.
Yes, I just want to go back to one point you mentioned there that's very important. It's the linking of information to action, which I think is really key. We did when we were developing the regional cervical cancer strategy, we did a survey with our countries, and we got a lot of responses from the countries where they said women do not know women do not seek care, which wrongly can be putting the responsibility on the women. But we know also that the reality is that in many settings, those healthcare interventions are not available. So it really requires it's an important role of policymakers, but all the stakeholders to make sure, one, that the treatment is there, but two, that it's accessible and that they can, as you say, link it to action, because sometimes the action is maybe not even possible. So thank you for highlighting that. Could you maybe also tell us something, because you also work with innovative technology when it comes to the treatment. So could you maybe share some examples of emerging cervical cancer treatment and the type of treatment that is taken?
Yeah, we spoke a lot about vaccination. This should be at the core of everything, because this is the preventional part, right? There's no better way than not getting cancer in the first place. So no question about that. But if it happens, there more and more, and we see this huge progress in the therapy options of the new cancer therapies that are tailored to individual patients and disease characteristics. So to improve the likelihood of patients to respond to the treatment. This is the new paradigm shift we see, and there are advanced progress already in other indications like lung, where this concept has been established quite some time ago, where we see that 1995, 5 out of 100 lung cancer patients survived. Today, this number has increased 10 times. So with these new treatments in place, we see survival rates as a very good level of quality of life for the individual. This means that people can enjoy their life with the families, with their children, and have a brighter future. This is common as well for the cervical cancer space. So this is a targeted therapy where the body's own immune system can be activated to attack tumors. And this is precision medicine, like we call it. And yeah, it will certainly help cancer patients also in the cervical cancer space to have better outcome and see survival rates.
Thank you very much. So those are some of the, but of course we are aware of the fact that those are also types of treatment that are more costly and might not be accessible to many of the people in some parts of our region. And except of course the surgical and the medical part of the treatment, we know that in our region, two elements of treatment that there is a big lack of in some parts of the what we call the Eastern Mediterranean region is radiotherapy and the palliative care component of the treatment. And I would like to take the chance to go back to Professor Humaid. Mentioned you're a strong advocate for palliative care, and I would like to, as this is it's an important element of the treatment aspect, and there is also a lot of misconceptions of palliative care being end of life care, which it is not. It is symptomatic care that should start at the onset of diagnosis. But could you please tell us about the importance of palliative care as part of cervical cancer management, and what are some of the special considerations and symptoms that makes this extra important for cervical cancer? Over to you.
So thank you for your question. And in fact, patients with cervical cancer, they tend to have deep pain in their pelvis because of the nature of the cancer. It grows in the pelvis area. The pelvis area is very small, so it can compress the nerves and can cause severe pain. So when we talk about palliative, people think that it's only about symptoms management, end of life. But palliative care actually with patients with stage 4 starts from day one, because whatever you give them with chemotherapy is considered to be a palliative chemotherapy. So we're trying to palliate their symptoms, giving them chemotherapy, which does help to improve survival by controlling the tumor, reducing the pain and trying to improve their quality of life. So chemotherapy was one of the tools that we have. Also, we have radiation. If the patient did not have radiation before, maybe sometimes patients they have chemoradiation. After a few years, they have a recurrence. So sometimes we can re-irradiate again. Sometimes we can, depends on the dose that they have received before. Sometimes we also have to go for something called pelvic centration, where you have to go inside using surgery to remove the important organs like the bladder, the cervix, and other organs if it was not removed before, trying to alleviate the patient pain. But this is huge surgery, which can cause also significant morbidity. Also, we do use different medications, morphine, opioids, without any stigma. Patients with cancer, they shouldn't be living with pain. We have to be very mindful about, how can we treat them, trying to improve their quality of life, minimize the side effects, and trying also to have them good quality of life and surviving or living with their cancer. So we do have different tools. And the last thing I need to mention, sometimes also we use nerve block when the cancer is spreading way beyond radiation and chemotherapy. We can use that modality to control the pain, which is our biggest problem with patients with cervical cancer.
Thank you very much for that. But moving back to the prevention side and making sure that we look towards a future where we don't need to reach the treatment of cervical cancer one day, I would like to go back to Dr. Kamal and the HPV vaccination. You mentioned previously the Gavi support to some countries in our region, low-income countries, but there's also some support for middle-income countries. I would like to ask if you can maybe elaborate a bit on that, but also tell us a bit about how WHO specifically supports member states in their efforts to introduce HPV vaccine. Over to you.
Thank you very much for this question. Regarding the support, this is a very important issue in supporting this very important vaccine. As it is mentioned many times, this is a costly vaccine, but as one of the cancer prevention vaccine, it is one of the highest return of investment vaccine. So all countries now would be looking at this vaccine as a preventing a terrible disease with a high return of investment and should think thoroughly about introduction of this vaccine. However, we have one competing priority in most of our countries in the regions. In the region, we have 22 countries. 6 out of them are the Gulf countries who are high-income countries. We have 9 countries who are middle-income countries, whether high middle income or low middle income. And we have 7 Gavi-eligible low-income countries. Gavi is supporting strongly the low-income countries, but recently in 2022, they started to adopt a new policy to support also middle-income countries to be able to afford for this vaccine. Even for high-income countries, when they have the vaccine, it is free of charge for only national and residents. So it has a kind of a minimum problem related to the cost. But middle-income countries have a severe problem related to the cost because they have other priorities, especially communicable disease vaccines, which is very more prevalent in those countries. So they are trying to avert deaths among children by introducing in the routine immunization program other vaccines that prevent death of children out of diarrhea or respiratory disease or others. So they are not putting HPV on first priority because of this first reason and the second reason for the cost. Talking about the technical support, actually, as it has been mentioned many times, and even Dr. Lamia has mentioned it, one of the most important enabler is the advocacy, communication, and social mobilization, not only for the cancer cervix as a whole, but specifically also for HPV. So the WHO is supporting technically all the countries to develop a vaccine introduction plan. But for this specific HPV vaccine, we need another parallel communication plan, like it has been done recently with Morocco, for example. A whole specific communication plan has been developed in order to support this vaccine, knowing that this vaccine is not like other vaccines. These vaccines need to be introduced with high coverage in order to make sure that we have the cohort immunity. So in this vaccine, we need to have a very strong introduction plan, very strong communication plan. Here, WHO is affording all technical support to all countries in the region to develop their plan and also to develop the application for Gavi, whether low-income country or middle-income country, in order to be able to give the needed financial support to introduce this vaccine, also to maintain these vaccines throughout the years, because even the support given by Gavi to high-income country and in the future for middle-income country is going to be for a grant for introduction of the vaccine, subsidized price of the vaccine, but not for the operational cost. The operational cost is a substantial cost that should be considered by the routine immunization program in order to make sure the sustainability of giving this vaccine and to maintain the highest possible coverage in order to reach the goal. Over to you.
Thank you. Thank you very much. We are getting close to the end of the session, but I would like to take the chance to also ask Dr. Iman a question related to, I mean, we have great opportunities when it comes to screening also, but I would like to ask if you could tell us a bit about mobile colposcopy and how this can contribute to more effective screening and treatment of precancerous lesions, and perhaps even more in hard-to-reach areas or places where women cannot access healthcare services easily. Over to you.
Yeah, okay. Now, as the projection rate in Dr. Shamsi mentioned that the projection rate in the United Arab Emirates expected to be 300%. For us, we expected, according to WHO, the projection rate for us is 45% by 2040. This is what worries me, because there is no national comprehensive screening program, and the immunization, still the vaccination, is not part of the immunization program in Kuwait. So I thought if we invent the innovation of the pocket colposcopy, the reason behind this, that not because of I'm sure it is less expensive than the traditional one, but because it is smaller and lighter and more convenient for the doctors to be in the polyclinics or the units, not in the hospital. So it will be easy for the health providers to zoom and capture the images after they look into the cells without, again, speculum. There are many, as I heard, there are many in the market now, pocket colposcopy. You can look into the cervix without a speculum, so they can zoom and capture the images by press whatever on the mobile colposcopy, and then they can transmit instantly these pictures to the smartphone, to tablet, whatever, to the referring doctor, to us, for example, because we are only having one cancer center in whole Kuwait. We are draining roughly 3 million or 4 million population. So this is the main referral center in Kuwait. So if the health provider in the polyclinic can look into, introduce the device, the very thin device, into the vagina, image the cervix, and send this picture for us to be analyzed. So in that sense, we can identify the high risk sort of patient, or the one who have abnormal cervixes, and then they can get the referral, and then they can get biopsy, so you can cut down the latest stages of presenting cancer cervix. Yeah, over to you, Dr.
Thank you for that, Dr. Iman. Yeah. I just have one last question, and I leave it open for anyone who would like to take it. We've suffered a lot during the COVID-19 pandemic, but there has been infrastructure developments during the pandemic, such as the improved PCR capacity and the capability of COVID-19 vaccine platforms that could help accelerate the elimination of screening and vaccination programs. In what way could these be opportunities, and have you seen examples of it being used? I don't know if anyone wants to volunteer or have any thoughts on this.
Not this specifically, but I would have another example, because this COVID time was when we all had to stay at home, and this huge training we all perceived, we all became IT literates, right? We became IT experts in connecting, and I think I didn't like it, not at all, no question. I hated it to sit at home all alone and just being surrounded by my computer. but we learned. And I think this was a huge progress when we come back to the stigma, to awareness, to learning. And this is an example that actually came out of this online training and education. Was the International Alliance of Patients organization, IAPO, created the Personalized Cancer Alliance with a women's cancer focus in our region. And this was established actually 1.5 years ago. And I saw really huge efforts made there in terms of training, in terms of providing people a network that they can link to where training modules were offered. And now we see on the World Cancer Day, prior to the World Cancer Day, I have to say, there will be a report launched. There will be a member of WHO presenting it with us on the panel about the patient voice in personalized healthcare. In exactly this area, we speak of what they need and what hurdles they perceived. I think this is a beautiful example, even if we were forced into it by getting online and getting IT literate. It helped us to perhaps in this diverse big region to connect and to learn how online managing networks and training and progress is made. This was just my 2 cents from my end, and thanks so much.
Thank you for beautifully highlighting this aspect. So coming out slowly, inshallah, from the COVID pandemic, we have a better supply of HPV vaccination. We have better vaccination platforms. We have better PCR capacity for HPV testing. And we are more IT literate and can actually have bigger opportunities in capacity building that is needed, awareness raising among the public. And so I think that's a good note to end with. There's a lot of good innovations. We have them at hand. Now it's time to move to the implementation. Thank you very much to our panelists, and apologies for the extra 5 minutes. Back to you, Micheline.
Thank you all for those insightful dialogues. And now I would like to introduce our last speaker for today, Ms. Reem Ahmadieh. Reem is a global public health professional with experience in communicable and chronic disease prevention and control. Her expertise includes health policy, communications, advocacy, governance, and multi-sectoral partnerships. She has worked with consultancy firms and UN institutions in Switzerland, Lebanon, and Dubai. In Lebanon, she worked on immunization projects, developed an EPI legacy with WHO, and planned and executed the National Masses Campaign to respond to the 2018 outbreak with the Ministry of Public Health. As a licensed clinical dietitian, Reem has public health expertise in health promotion. With a focus on the GCC region, she worked with the World Obesity Federation to develop formal guidelines for the management of obesity. Since joining GHS, she has been involved in facilitating events and campaigns related to public health. Reem will give us a recap of the first day of the 3rd Sharjah Regional Cervical Cancer Forum. Welcome, Reem, and the floor is yours.
Good afternoon, everyone. It is my pleasure to be with you today. On behalf of FOCP, UNFPA, ASTRO, and WHO, I will conclude the first day of the 3rd Sharjah Cervical Cancer Forum. Today, we came together virtually to discuss the necessary actions and collaborations needed to combat cervical cancer and save countless lives in the region. January marks Cervical Cancer Awareness Month, a time to highlight the progress made and work that remains to be done to eliminate this preventable disease. The theme for this year's Awareness Month is Ending Cervical Cancer Within a Few Generations through early detection, effective management, and a comprehensive approach to prevention, screening, and treatment. Bringing together healthcare experts and professionals and policymakers, the forum began with opening remarks from Her Excellency Sausan Al-Jafar, the chairperson and president of the board of directors at Friends of Cancer Patients, who warmly welcomed all attendees and expressed gratitude towards the partners who committed to the Sharjah Declaration. She highlighted the progress and commitment made since the last forum and expressed her hope in the WHO regional elimination strategy for cervical cancer, as well as the ongoing collaborations and partnerships in the region, specifically mentioning the collaborative project between FOCP and UNFPA to develop a monitoring framework on cervical cancer. His Excellency Dr. Abdulrahman bin Mohammed Al-Owais, the Minister of Health and Prevention in UAE, thanked FOCP for their efforts in the fight against cervical cancer. He highlighted the remarkable progress that UAE has made in controlling and managing the disease and reaffirmed the country's dedication and commitment to eliminate cervical cancer. He emphasized the need to continue these efforts in order to achieve more progress and extended his best wishes to other Arab countries in their own efforts to combat cervical cancer. Dr. Hala Youssef, the Sexual and Reproductive Health Advisor at UNFPA ASRO, provided an overview of the monitoring framework on cervical cancer that was developed in response to the Sharjah Declaration following the last forum. She urged everyone to maintain the same level of momentum and to renew commitments. Dr. Dana Al-Hajj, Director of the Program Management at WHO EMRO, highlighted the alarmingly high prevalence of cervical cancer in the region, resulting in the loss of many women, mothers, friends, and daughters. She emphasized the health disparities and inequities among vulnerable women who lack access to healthcare services in the region, and stressed that we cannot turn a blind eye to this issue. With collaborative efforts, we can achieve cervical cancer elimination. The forum today focused on two main themes related to cervical cancer elimination and management. The first theme of the forum was the monitoring and evaluation framework that tracks the progress of cervical cancer elimination efforts in 6 pilot countries: Oman, UAE, Libya, Qatar, Morocco, and Sudan. Ms. Nahla Saer presented the monitoring and evaluation framework that aims to improve governance and accountability of related programs, as well as it tracks progress at the country level by highlighting the needs and ongoing efforts of key stakeholders, and by promoting better data collection, analysis, and utilization of evidence-based decision-making. The outcome of this framework is advocacy and implementation of regional and national cervical cancer strategies in line with global initiatives. Moreover, the framework focuses on partnership and South-South cooperation to enhance cervical cancer control capacities and establish a robust monitoring framework for HPV vaccine implementation and cervical cancer elimination. Dr. Nasreen Kamal then presented the progress of HPV infections and cervical cancer in the Arab region, emphasizing the importance of using monitoring and evaluation tools to track progress and make data-driven decisions to improve cervical cancer management. She highlighted best practices and gave more specific examples, such as the cost-effectiveness of screening, the importance of healthcare providers in promoting health literacy, and the commitments made following the Sharjah Declaration. The first panel today was on the necessary steps and requirements for a successful scale-up of cervical cancer prevention strategies. The speakers discussed the patient journey through cervical cancer diagnosis and treatment, and the importance of understanding the specific context of each country to address preventive barriers. They also emphasized the need for raising awareness, and Dr. Sulafa provided an update on Mazaya's project, which aims to promote screening among women as a preventative measure. Dr. Aida discussed the prevalence and mortality rate of cervical cancer in the UAE and highlighted the campaigns that are being implemented to raise more awareness and educate the public about HPV. Ms. Maysoon emphasized the importance of strengthening infrastructure and partnerships to achieve the goal of eliminating cervical cancer and suggested implementing school-based vaccination as the primary approach and integrating educational messages within the school setting. Dr. Maribel agreed and added that they must also make any program implemented sustainable by ensuring a treatment capacity is in place. Setting the stage for the second theme of the day, which is the WHO Regional Elimination Strategy for Cervical Cancer, Dr. Afifi highlighted the significance of considering women's health when working towards eradicating cervical cancer in the EMRO region. He stressed the importance of addressing various determinants that impact women's health, including access to quality healthcare, education, and employment opportunity. To make progress, Dr. Afifi suggested utilizing existing efforts and seeking out opportunities for collaborations, prioritizing and providing technical support for relevant programs and activities at both the regional and country levels. For the first time in history, we have the opportunity to eliminate a cancer, specifically cervical cancer. Dr. Lamia Mahmoud presented the WHO regional elimination strategy that can make this a reality, beginning by highlighting the survey findings and regional barriers, and then she delved into the strategy itself. The strategy focuses on the 90 targets and 2 additional enablers. The strategy aims for countries to achieve 5 key actions in total. The first, primary prevention. The second, which is secondary prevention, management, health system strengthening, and finally, communication, advocacy, and social mobilization. On a positive note, the day ended with informative speakers who came together to discuss the latest innovative ways to support the elimination of cervical cancer and promising upcoming treatments that will help more women become cancer survivors. These included advanced cancer therapies that increase the chances of patients responding to the treatment, mobile colposcopy to evaluate abnormal cervical smear, patient self-urine sampling for HR-HPV testing, advocacy initiatives such as the Women's Cancer Patient Forum platform, which empowers women living with cancer, caregivers, and cancer survivors by educating them about cancer care and providing a platform for patient organizations to address common challenges such as stigma, insufficient screening programs, low public awareness, and barriers to accessing innovative treatments through the healthcare system. Overall, the forum today was a valuable opportunity for experts and healthcare professionals to share their knowledge and experiences on cervical cancer management and to discuss ways to achieve cervical cancer elimination as a public health problem. The panels were eye-opening as they highlighted the importance of addressing the high incidence of cervical cancer in the Eastern Mediterranean region, which is generally higher than the global average. All speakers agreed on the importance of prioritizing cervical cancer prevention and control efforts, including HPV vaccination and cervical cancer screening, in order to ultimately achieve the goal of ending cervical cancer as a public health problem within a few generations. We would also like to take the chance to encourage you all to continue the conversation and make a difference during and beyond this forum. Building relationships and sharing experiences with fellow healthcare professionals can be incredibly valuable in advancing the fight against cervical cancer. We are grateful to all our panelists for their contributions and to all attendees for joining us today and for your continued commitment to ending cervical cancer as a public health problem. Let us continue to work together towards a future where cervical cancer is no longer a threat to the health and well-being. And hopefully you can join us again tomorrow to the continuation of this insightful discussion. Thank you once again for your participation.
Thank you very much, Reem, for this recap session. And now, coming to the end of the first day of the third Sharjah Regional Cervical Cancer Forum, we were hosted by Friends of Cancer Patients in partnership with the United Nations Population Fund Arab State Regional Office and in collaboration with WHO. We would like to thank the supportive partners, Ministry of Health and Prevention, Emirates Oncology Society, Day, Kuwait Cancer Control Center, Mazaya Charity Organization, Qatar Cancer Society, and Rufaida Women's Health Organization. A big thanks as well to our official sponsor MSD and to Conveners team for all their efforts. A reminder that this forum is CME accredited accredited by Dubai Health Authority with 9 CME hours. So don't forget, dear attendees, to fill the evaluation form in order to get your certificate of attendance by email. Thank you all for joining today, and looking forward a successful day tomorrow. We will start at 10 a.m. UAE time. See you all tomorrow. Thank you very much.